Father in heaven, we thank you for the privilege of being here at your church, a church who serves the community, a church who has dedicated the building and everything for your glory. At this point, we would like your blessing upon Dr. Wesley Youngberg. Give him wisdom and bless the community. In the name of Jesus, we pray, amen.
Thank you, Yvette. Thank you, Yvette, let's give her a hand for organizing this event. I wouldn't be here if it wasn't for her, so thank you. I just came off of speaking about 4 times at the Wildwood Cardiology Conference. And so I called my brother John and said, hey, I'm going to be in your area in early May. And he says, great. And then Yvette had the idea, let's do a talk at our church. And so, again, it wouldn't be happening unless she put it together. Thank you so much. This is if I could get the slides, please. Okay, here we go. Yeah, so this is a topic dear to my heart. I have a real passion for helping individuals reverse diabetes. You'll see real quickly, and I want to make this presentation very practical today. For those of you who want to prevent it, for those of you that think that it might be already starting in your lives, and you know, there's a lot of people that have at least prediabetes. Almost all of us in this room have some level of insulin resistance. It's ubiquitous. That's literally 90% of the population have a measurable level of insulin resistance, and I'm going to give you real practical strategies and tips on how to assess that and how to reverse that. The vast majority of us also, as adults, have at least prediabetes. Okay, if you're basically between the ages of 20 and 50, there's basically at least 30, 40, 45% of us already have minimum of prediabetes. 90% of the individuals with prediabetes have no idea they have it, and I'm going to show you a test that will actually determine whether you have it, because the average test done today for a physical, a fasting blood sugar, etc., even a hemoglobin A1C are very poor predictors of whether you currently have prediabetes. They're good tests. Don't misunderstand me. I do fasting blood sugars on all my patients. I do hemoglobin A1Cs on all my patients. The hemoglobin A1C is a very poorly named test because what patient remembers hemoglobin A1C, right? But what it is, it's actually a pathology test. It's a test that measures how much blood sugar, glucose, irreversibly attaches and binds and amalgamates with the proteins all through your body. Okay, so when we're talking about a hemoglobin A1C, we're measuring that caramelization, that irreversible caramelization or glycosylation, that amalgamation, that binding of glucose sugar to proteins, in this case in the hemoglobin protein of the red blood cell. I'm reminded that if you want to have this translated into Spanish, you can go in the back and you can have translation. We're going to have plenty of time to do group Q&A. And that's going to include the Spanish-speaking audience that doesn't speak English very well. They can actually ask questions through the translator, and so you'll all have a chance in English or in Spanish to ask your questions. Okay, so I'll be thinking about what the question. Hopefully, I'll answer a lot of the questions throughout this morning presentation. But I'm really eager to answer every question that you have if I can. So the hemoglobin A1C test is a measure of how much caramelization. Now, how many of you know what caramelization is? You know, you're cooks. You know, anybody that has caramelized protein, okay, added honey or sugar to protein, and it changes the protein, right? It glazes it. Have you ever tried to unglaze a donut? Once you caramelize something, you can't uncaramelize it. I guess if you chew it long enough and eat it, maybe you're uncaramelizing a little bit. But so the point is that the hemoglobin A1C blood test that everybody should have, just a quick measure. A lot of people don't know about this test, but how many of you know what your hemoglobin A1C blood test has been sometime in the last 5 years? Raise your hand. Okay, about half of you or a third of you. All right. So one of my goals, and we're going to be learning here, the first steps in understanding. You know, it was Plato who said, know thyself. And that includes understanding what our risks are. I used to think when I was in college, I thought I was the healthiest person I knew. I was really into fitness. I was really into health. I was really into nutrition. I exercised every day. I worked out. I did all these things, and I was constantly reading books on health. I was really interested in this primarily because I had had a horrible experience as a young boy. I witnessed my mother die of brain cancer when I was 10 years old. And that changed me forever. I became passionate about health. I remember asking my dad, why did Mom have to die of cancer? And he didn't really have an answer for me, obviously. And then I remember saying to him, I said, Dad, I wish I knew what my risks are right now so I could start working on them, so I could start addressing them, so I could reverse them now, so I don't have to suffer like Mom did, dying at age 39. And so I had basically worked really hard at doing everything that could optimize my health, and I wasn't doing it from a legalistic standpoint. I was doing it because I loved it. I was passionate about it. But it was only when I started testing myself, you know, doing some blood work and testing myself, that I realized, man, I'm not as healthy as I think I am. Now, and at first I felt really bad. I thought, man, all this stuff that I'm doing, you know, have you ever felt that way? You know, you're feeling like you're doing everything right. You go to get your physical and your doctor says, oh, well, you got prediabetes, or you got hypertension, or you have this problem or that problem. And you go like, what? And so our first impulse is to say, everything I'm doing isn't working. I may as well not even do it. Don't make that mistake. Okay, all that is telling you is that there's something else that you can do to further enhance and improve your health. That's the key. We should always be looking for what is missing. We should always be asking the question, okay, I'm doing this, and I'm feeling really good about my overall wellness protocol, but what am I missing? And you know what? There's always something missing. There's new research coming out every week that gives new insights on things that we might be missing. I remember about 8 years ago, I did genetic testing on myself. I now recommend genetic testing on all my patients. Okay, and some people say, oh, don't worry about genetics because genetics isn't the problem. It's what we do with our genetics that's the problem. Yes, that's true. It's our lifestyle. It's, you know, the genetics loads the gun, but it's lifestyle that pulls the trigger. Okay, but that doesn't invalidate the value of understanding your genetics, because see, there's a huge misconception about genetics. There's this idea that since you can't do anything about it, it's genetic, why even find out? Why even test it? Why stress ourselves out for the rest of our lives about a condition that's genetic, suggesting that we can't do anything about it? And that's the misinformation there. It's never been true. I was taught that in school. You got genetic diseases, you got modifiable diseases that are non-genetic, and then you got genetic diseases that are non-modifiable. That's simply not true. That's the old paradigm that was never true. We thought it was true, but the reality is when you discover you have a genetic mutation, we know enough in medical science now that it tells you precisely where on the biochemical pathway that problem, that enzymatic defect is, because the mutated gene causes a deformation of the enzyme that's supposed to stimulate a biochemical pathway to keep it healthy. And if there's a mutation, that means that biochemical pathway is not going to work right. So when we do a genetic test and we discover we have like an MTHFR mutation or a PON1 mutation, which decreases our ability to get rid of toxins. It's a very common problem with neurologic conditions is that many of my patients have a double copy mutation. That means a copy of the mutation from dad and a copy of the mutation from mom, and now we have a double copy mutation. So now we have a much more difficult time processing and inactivating, neutralizing, getting rid of pesticides. And how many of us, think nothing about taking some Roundup and spraying it around the yard and to keep the yard looking nice, okay, or to spray the fruit trees, etc. We don't think much of that but if we knew that we had a major mutation that dramatically limited our ability to break down that pesticide, now that pesticide is causing severe damage in our body for years and decades because it doesn't leave. Okay, so knowing about that mutation gives us an idea of what to do now to help decrease our exposure to it, to neutralize it with the right nutrients, and to help the body grab and excrete that out of the body. Okay, so about 8 years ago when I did this extensive genetic review on myself, because I was recommending it to all my patients, I said, well, I should do it for myself, right? And I discovered I had a major blood clotting mutation called factor V Leiden. It increases my risk of having a blood clot by 800%. Now, how do you think I responded to that? Maybe 10 years earlier, I might have said, why me? How could this happen to me? I'm trying to be so healthy, and then I find out I have this major mutation. I'd almost feel like I'm being neglected by God. But that's not how I felt. You know how I actually felt when I first learned about it? I celebrated. You know why? I literally did. The reason I celebrated because I said, yeah, this is one more way that I can now improve my health dramatically, because the day before I didn't know about this mutation. I didn't realize that was a high risk of a major blood clot, a heart attack, a stroke, a pulmonary embolism, a deep vein thrombosis. I didn't know I was going to get I was at high risk. Okay, but now I know, so I can start implementing preventive strategies now, not 5-10 years later when I have a massive heart attack. Right? And a lot of people are getting blood clots right now. That's why I'm now checking a D-dimer blood level on every patient. I never used to do that. It's since COVID, okay, and everything that's happened because of COVID, dramatic rise in blood clotting. So now I'm checking D-dimer levels. This is a blood test that measures whether you're breaking down a blood clot. And a lot of us are walking around right now with micro blood clots. These are very small blood clots. So there's no obvious blood clot that you can measure with an ultrasound, but it's there. It's sluggish blood throughout the heart, the lungs, the brain, everywhere. It's impairing circulation, and it's dramatically increasing the risk of a heart attack, stroke, even diabetes, and certainly Alzheimer's and dementia. So the bottom line here is that we want to be taking advantage of every strategy of testing. The more we test, the more we become aware of both our strengths and our weaknesses. Anybody in business, anybody here in business, right? If you're in business, you probably have done a SWOT analysis, an analysis of your strengths, weaknesses, opportunities, and threats. That is exactly what we should, as individuals, always be doing on our own health, physically, mentally, socially, and spiritually. Doing that SWOT analysis, Yvonne. What are the strengths? What am I doing right? What are my weaknesses? And how do we figure out what our weaknesses are? By testing, by analysis. And so I'm a believer in broad-based testing on a lot of different blood tests and urine tests and stool tests that give us clues for things that otherwise we'd have no idea about. And we could live the next 10, 15 years much less healthy without realizing it because of the lack of knowledge, the lack of understanding. You know that Bible verse, my people perish because of? The lack of vision or lack of knowledge. Okay, so let's jump right into. So I'm going to be sharing with you. I first became passionate about the idea of that we can actually reverse diabetes, reverse prediabetes, reverse insulin resistance in 1985. In 1985, I was a student at Loma Linda University studying lifestyle medicine and preventive care. And I went to the spring seminar series that was organized by the School of Public Health. And they had invited Dr. James Anderson. He's a world-renowned endocrinologist, an expert in diabetes care, who talked for an hour to us students about how he had been publishing research in the 1970s on reversing diabetes naturally. In fact, he was even showing that 90% of the time, his hardcore, brittle diabetics were able to reverse their diabetes in a hospital room with just changing the diet. Now, I am not advocating only changing the diet. I'm just saying that diet is so valuable, is so powerful, that even just doing that powerfully alters your metabolism and can reverse diabetes in many people. And this is in a month's time in a hospital. They weren't even exercising. Okay, so of course we want to do everything that's going to work, right? It's going to increase our abilities. So is Dr. James Anderson, a renowned, well-researched, heavily published doctor who was doing this 50 years ago. And then when I started talking about it myself after hearing this, I'm going like, how come I've never heard this before? So I started talking about it, and people say, oh, no, only quacks. There's no evidence that you can reverse diabetes. Have you ever heard that? You're going to have this condition for the rest of your life. You're going to need this medication for the rest of your life. Well, if you don't treat the cause of the condition, that will be true. The more and more medications you take for diabetes, the longer, oftentimes the worse it gets and the longer you're going to have it. So this has been true for a long time. It was actually about 10 years ago that I first worked with the American College of Lifestyle Medicine that I actually helped found about 21 years ago now. I was one of the original board of directors of the American College of Lifestyle Medicine, and we put together a continuing medical education course called the Remission of Type 2 Diabetes and Reversal of Insulin Resistance. It's a certificate course for doctors and health professionals, that a comprehensive set of lectures that we all did to help other doctors realize we should now be promoting reversal of diabetes, not just management, not just we can help control your blood sugars. That's not good enough, because controlling your blood sugars does really not dramatically lower your complication rate. We need to, and this has been well documented in Mayo Clinic studies. We're not going to get time to go through all those studies because I want to be real practical today. So I just want to quickly go through this introduction. Bottom line is, why do we want to reverse prediabetes? Why do we want to prevent it? Why do we want to reverse and prevent diabetes? Is because it is one of the biggest drivers of dementia and neurologic conditions. I became very passionate about helping people with early forms of dementia or a family history of dementia. Like my brother and I have a major family history of dementia. I'm on the whole program myself. I'm studying this every day for my own benefit, but I'm able to share that with all my patients now. So I see patients all over the country and even other countries on Zoom, helping them work through and help them literally reverse their signs and symptoms associated with dementia. It's not easy, but it's doable. If you have, where there's a will, there's a way. Okay, so bottom line is that addressing this problem that I'm going to help you understand today is the number one strategy to prevent, to slow down, and to even help reverse issues with dementia. Okay? So that's why this is so important. So, and there's all kinds of studies that document this. Dr. Suzanne de Lamont, the neuropathologist at Brown University, has been publishing studies referring to Alzheimer's disease as type 3 diabetes. It's insulin resistance of the brain. And so once we fix insulin resistance, we dramatically improve function of the brain. She's been saying this since 1990. And then I was able to publish a review paper in 2018 in the American Journal of Lifestyle Medicine entitled Clinical Lifestyle Medicine Strategies for Preventing and Reversing Memory Loss in Alzheimer's. Okay, and so all the strategies are there. You can look that up. It's actually available online. The American Journal of Lifestyle Medicine in May of 2018. So I'm just giving you a quick snapshot that what I'm talking about is just not some idea I came up with. This is well documented in the medical literature. And the key is, now how do we put this into practical terms? We know that high blood sugars, even mildly elevated blood sugars, are already causing cognitive decline. They're literally causing atrophy or breakdown of the memory cells in your hippocampi. They're basically gradually destroying this part of your brain that consolidates short-term memory into long-term memory. And you know what? You can get that back if you've been losing it. You can get it back. You can regenerate. You can actually have what we call hippocampal neurogenesis. You can grow new memory neurons in your hippocampi. In fact, if you're not growing new ones, there's a problem. That means you're going to have problems. Okay, so high blood sugar is bad, high insulin levels are bad, low insulin levels are bad, low blood sugar is bad, low cortisol is really bad, high cortisol is really bad. We need to learn how to balance all this out. So let's get to it. This is very clear that insulin resistance is actually one, in many studies, has been shown to be the biggest risk factor driving coronary artery disease, the main cause of heart attacks, and also carotid artery disease causing strokes. And so it was Dr. David Eddy, an MD, PhD. He actually had a PhD in mathematics, an interesting combination, a mathematics genius in medicine. And he developed some of the early artificial intelligence strategies to figure out what works and what doesn't work. And so he published this study, I believe in 2009, in the journal Diabetes Care, which is worldwide is considered to be the #1 most important journal for diabetes medicine. And he showed that he actually did an AI simulated study looking at a National Institutes of Health large database, tens of thousands of individuals, and he had all the data on these real patients, but what they did is they looked at them when they were 20 years old, and they looked at all the data of a 20-year-old, and they just changed one risk factor at a time, and they had the computer analyze through AI methods what would change over the next 60 years when they turned 80, and they asked the question, by controlling one risk factor only, how much of the risk of coronary artery disease were we able to eliminate? The risk of having major plaque buildup in the arteries, or literally having a heart attack. And they found that insulin resistance was by far the biggest risk factor, way more important than cholesterol, triglycerides, even smoking. It's very, very important. So in other words, we got to figure out how to reverse insulin resistance. But you know what? Some of you are probably saying, what is he talking about? What in the world is insulin resistance, right? So we're going to look at that right now. So when we're trying to really understand our risk, we need to understand what's going on with our pancreas. Because, see, the pancreas is an organ that is responsible for producing many things. It's a major digestive organ. It releases lots of digestive enzymes to help digest your food and absorb nutrients, vitamins, and minerals from your diet. Okay, but it also has little pockets of cells called islands of Langerhans. These are little islands of tissues within the pancreas that have very specialized function. And one of the types of cells in these little islands in the pancreas, there's like multiple, there's dozens, if not hundreds, of these little islands of cells, of tissue. And one of them is called a beta cell. And the beta cell is responsible for making insulin and releasing insulin into the bloodstream. And so it's like a little thermostat on the wall. If the blood sugar starts going up because we've consumed a meal that has carbohydrates in it, as the blood sugar goes up, the pancreas says, hey, sugars are going up. We need to release insulin, and it releases just enough, or should be releasing just enough insulin to bring the blood sugars back down into balance. And so prediabetes, and even pre-diabetes, and certainly diabetes, means that balance has been broken. That is way out of balance now, and we need to figure out what are the multiple causes of that, and we need to have quick ways of assessing of what we're doing and how that's impacting our results. And I'm going to show you exactly how to do that here shortly. So the key to understand is that if we don't know what's going on, and we just keep doing what everybody else is doing, because what everybody else is doing is causing prediabetes in almost everybody. By the time you're 75 years of age, three-quarters of the entire population has at least prediabetes, and 1/3 of the entire population of individuals over 75 have full-blown diabetes. Okay, but it's also true that if you're over 40, and I'm assuming that most of us are somewhere after 40, okay, and that most of us already have prediabetes. But most of us don't know we have it because we haven't done the right test. So we're walking around thinking we're healthier than we really are. That's why 1/3 of all heart attacks ends in sudden death within 24 hours. 1/3 of all heart attacks is the first symptom that people have of any heart disease, and they're dead within 24 hours. Okay, that's very sobering. Okay, so in other words, don't wait until you find out you have a problem to do something about. Be proactive and start looking for risk factors. So the pancreas initially, in almost all of us, is working harder than it should have to. How many of you have ever run a marathon? Okay, there's several of us here. I ran the very first LA Marathon in 1986. I trained for it for 6 weeks. Laughter. Okay, so you know that I was hurting. I was hurting during that marathon. I was in pretty good shape, but I was not in good enough shape to do well on a marathon. So it took me a long time to get through it. And many of my friends who were also in very good shape, we were students at the time, some of them had pulled hamstrings or messed up their knees. It's a major trauma to the body. Okay, what would happen for those of you that do run regularly if you did a marathon every weekend? How long would we be able to do that before the body completely breaks down? Not long. Not long. In fact, the body's already breaking down during the first marathon, right? So the point here is that we don't want our body to be struggling and overworked all the time. That's what's happening with our pancreas. Our pancreas is, every time we eat a snack, every time we eat a meal, the pancreas is having to produce insulin. So is it possible through proper management and consideration, eating a diet that stabilizes our blood sugar so effectively that the pancreas goes like, oh, I only have to produce about 10% of the insulin now. than I used to have to be forced to produce. So now the pancreas is going like, oh, I can do this, and the pancreas gets stronger and stronger and more resilient and more resilient. Now you have a really healthy, robust pancreas that, if necessary, can produce a tremendous amount of insulin because it's resilient. But see, the problem with most of us is that our pancreas, little by little, is wearing out. And I really mean that. I'm not talking about by the time you actually have diabetes for 20 years, your pancreas is shot. No, I'm not. I'm saying that you'll see in a minute that over half of your ability to produce insulin is lost even before you reach the definition or the criteria for pre-diabetes. So this whole idea that pre-diabetes is just, well, it's just kind of a warning. You want to be careful now because you don't want to develop diabetes. No. If you're pre-diabetic, that already is dramatically increasing your risk for a heart attack, for a stroke, for cancer. Did you know that? Pre-diabetes dramatically increases your risk for colon cancer, breast cancer, prostate cancer, even skin cancer. Dramatically. We've known this for over 45 years. But when's the last time you've heard about that? It's just not talked about. Okay, so insulin resistance, or when the body has to make more insulin to try to correct for the high blood sugars because your cells are full of energy, they don't need any more energy, and so they resist the work of insulin, and the pancreas says, hey, my job is to get the blood sugars down, so it just makes more insulin. Just like a type 1 diabetic who says, well, my blood sugar's high, and I want to have my donut and latte, so I'm just going to take more insulin. And that'll help control my blood sugars. But is that a very healthy way to do it? No, because all that extra insulin is now causing damage to the body. In fact, it actually causes damage to the brain and to the heart. So we're in a scenario, most of us in a scenario where the pancreas is being forced to overwork, and for a while, it can produce a lot more insulin and fully control your blood sugars. I have worked with many patients who we do a full 4-hour glucose tolerance test, and I'll show you how you can do that. I'm going to show you how you can order it yourself. You don't even have to convince your doctor to do it. You can order it yourself, because most doctors think it's an outmoded, unnecessary test, and I 100% disagree. I've been ordering this test for 35 years, since 1990, and it is the best test. In fact, it's really the only test that really gives you the full picture. It's like a 3-dimensional view of your metabolism, and I'm going to show you precisely how to interpret that test today, so that I met somebody at the cardiology conference at Wildwood yesterday who got the glucose tolerance test done because he'd read my book, and he said, I read your book 10 years ago, but I finally, just a few months ago, did the glucose tolerance test. He said, I had a heart attack. He's thin, he's fit, and he had a massive heart attack. So he's trying to figure out what's causing this. And he has 3 cardiologists, and nobody's giving him the answers of what caused his heart attack. And so he says, well, maybe I have a hormonal problem, an insulin resistance problem. So he made an appointment with an endocrinologist, and he told me just yesterday, he said, I got the appointment with the endocrinologist, and then on the day before my visit, the endocrinologist nurse called me up and says, we've decided to cancel your appointment. I go like, what? You know, is the doctor busy? Is he sick? He says, no, he's just canceling your appointment. It's like, what? Like, what? You know, it takes forever to get an appointment with an endocrinologist, right? Might take 6 months to get an appointment sometimes. And so he's going like, wait a minute, you got to give me an answer. And she said, well, the endocrinologist says, you really just need to see your cardiologist about it. He says, I've seen 3 cardiologists about this, and they told me to see an endocrinologist. Okay, and so the endocrinologist finally said, it was about 5 minutes he's holding on the phone, and then another nurse came on and says, Mr. Rubin, he just says he can't help you. And that was it. So he was like, He was aghast. And so fortunately, we had a talk just like this one last night at Wildwood, so he understood what was going on, and he had significant insulin resistance as outlined, as I'm going to show you here. So what happens is that if you don't find out that this is a problem early on, it just keeps getting worse. Month by month, year by year, it just keeps getting worse, and it's setting you up for It's initiating and promoting cancer dramatically. How many of you are aware that cancer has exponentially increased over the last few years? It's a huge rise, not just a gradual rise from before. This is a dramatic rise in all age groups, but in particular young people. There's general surgeons and pancreatic surgeons that are saying they're getting pancreatic cancer in 8-year-olds. Never heard of that before. Surgeons have been doing surgery like that for 30 years. They never once had an 8-year-old with pancreatic cancer. Now it's happening. There's all kinds of reasons. So we need to address all the underlying causes. And I'm not saying this is the only cause. It is one of the drivers. It's one of the ways that we're pouring gasoline on the fire. And so we need to address this fundamental metabolic problem. So it keeps getting worse, and eventually the pancreas gets fatigued, so it's still able to make insulin, but not enough to control the blood sugars. And only then does the blood sugar go up. So this idea of waiting until you get diagnosed with prediabetes is really foolhardy, because it can take decades of unhealthy metabolism and excess insulin production before you get to the point where your blood sugar starts to go up. So that's why you want to start treating that right away, aggressively. And then eventually, if we let this go, the pancreas actually fails. It literally just can't produce, and so it's producing so little insulin that the blood sugars become hardcore diabetic. So, well, as I already mentioned, this pancreatic burnout, the beta cells that make insulin in the pancreas, that even before prediabetes is diagnosed, it is common that the pancreatic function and insulin-producing ability is already compromised by over 50%. Okay, now, I'm going to read this because I want to get through this quickly and get to the tips. Dr. Ralph DeFranzo, professor of medicine and chief of diabetes medicine at University of Texas, he noted that individuals that are in the upper third of the pre-diabetic blood sugars, and I'm going to show you what that means in a minute, where the fasting blood sugar is just above 110, the 1-hour blood sugar after the beginning of a meal or of a sugar drink in the lab is just above 200. Now, most of us have never had a 1-hour blood sugar. The 1-hour blood sugar after the beginning of any meal or a soda or a sugar drink or juice is the most sensitive indicator of whether you have a blood sugar problem. But remember, that's not the beginning of the problem. That's somewhere around 10 years after the problem has already begun, because insulin goes up first, and then blood sugars go up when the insulin isn't able to fully control it. Okay, so, or a 2-hour blood sugar, that's why I'm going to show you how to do an extended glucose tolerance test in a minute. If the 2-hour blood sugar is just above 160, officially in 1997 was the very beginning when new diagnostic criteria came out showing that if your 2-hour blood sugar is above 140, that's officially prediabetes, which we call stage 3 high blood sugar. But if you're above 160, that is now stage 4 high blood sugar, one stage before full-blown diabetes. And then there's 5 stages of elevated blood sugars within the category of diabetes. We'll show you that in a minute. So if you meet any one of those 3 criteria, okay, you are in a situation where there's maximally or nearly maximally insulin resistant, and you have lost already how much percent? 70 to 80% of your beta cell function, the pancreatic function, its ability to produce insulin has already been lost up to 80%. And this is not even in a diabetic yet. This is in a pre-diabetic. Okay? So we want to pay attention to that. And I want all of you to go home today knowing exactly how to determine where you're at right now, and most importantly, what to do about it. Unless you know what's wrong, you can't fix it. Right? But we know how to fix this. This is very, very much fixable and reversible. So there's good news and bad news. Typically, when your insulin levels are high, the good news is your pancreas can make a lot of insulin. Your pancreas is still in the phase that it's able to produce a lot of insulin. The bad news is that even with all that extra insulin, you may be producing 5, 10, 20 times more insulin than you should have to, okay? But that extra insulin that you're producing is not enough to control your blood sugars. It's not enough to compensate for the fact that your muscle cells and other organ systems are very resistant to insulin. And even with all that excess insulin swimming around, you're not able to control your blood sugars. Okay, so that's the bad news, is that your pancreas has maxed out in its ability to make enough insulin to control your blood sugars. So we want to address both of those problems. Okay, so basically there are many things that are well established in the medical literature that damage the ability of the pancreas to make insulin. And I'm not going to go through this study in detail other than to summarize it with you right now. The toxins I already talked about briefly. That's why I love genetic testing, because it shows us who amongst us are really susceptible to toxins. And those are the people that are much more likely to get autoimmune disease. Those are the people that are much more likely to develop diabetes. The government, the NHANES data, that every 10 years during the census, they carve out whole subsets of populations, and they do blood testing on them, and they discovered that the amount of toxins in a person's blood was the number one risk factor for whether they developed diabetes or not. Way more important than whether they were overweight, way more important than how sedentary or how fit they were. Toxins in our environment are a major cause of what? Damage, toxicity to the insulin-producing cells of the pancreas. So we need to start thinking about what toxins are we exposed to. Are there tests that I can do, like urine tests, that help me understand if I'm high in these toxins? Are there other genetic tests that give us an idea of how susceptible we are to those toxins? You know, because some people can be exposed to toxins and their body just deals with it, neutralizes it, and it's over. But others of us get exposed to 1/10 of that amount of toxin, and now we have a major problem. So that's why we have to do what we call precision medicine. We can't treat everybody the same way. We need to focus on your risk factors and your susceptibility, and you need to understand that, or else you're really not going to accomplish your goals. So there's toxins, there's infections. In fact, those two things are in my book, Goodbye Diabetes, I have a chapter. It's actually a small chapter. I could have written a whole book on it. It's called The Hidden Culprits in Diabetes. And there's two main hidden culprits: toxins and infections. And most infections are actually subclinical. They're not detectable. Your white blood cell count doesn't go up. You're not feeling sick. You just have a chronic, low-grade infection. This is ubiquitous. This is a very common problem all throughout the world. And you know, a lot of people say, "Oh, we live in a first world country. We live in the United States. You know, we don't have chronic infections. We don't have chronic parasitic issues." Oh, yes, we do. And because we're not looking, we don't find it. And that they go on to damage us for decades, destroying our health little by little. So I just want you to understand, have you ever noticed in a friend or family member that when they get a cold or a flu, if they have diabetes, their blood sugars shoot way up? much higher than they normally. Somebody nod if you've noticed that. Okay, yeah, I see some of you nodding. So this is a classic thing. If you ever get a cold or a flu or any infection, a urinary tract infection, any infection, that's going to cause your blood sugars to go up. Why? Because it's causing insulin resistance. It's causing inflammation in your body. It's really bad for you. You're much more likely to get a heart attack or a stroke when you have an infection. Why? Because the infections are associated with releasing toxins. The bacteria or other microbes in the body, if they're building up in your body, they are generating free radical damage and toxicity to your entire body, including your brain. That's why my patients who have a UTI, or urinary tract infection, or an upper respiratory infection, or lower respiratory infection, any type of infection, if they have dementia already, if they already have significant cognitive decline, they get an infection, they go into like advanced Alzheimer's overnight. Now, they can come back from that as soon as the infection is reversed, and so that's why I refer to dementia as a transient experience. It's an exposure to dementogens, and that's the good news. If most of dementia is caused because we're under the influence of an infection or a toxin or the wrong diet or the lack of this nutrient, etc., that means that we can reverse that. Okay, so pay attention to those factors. Okay, now what is the most important step? I'm kind of giving some clues about this. And remember when I said Plato says, know thyself? What did that imply? We need to do some testing. We need to figure this out. So step one, I'm going to show you how you can do this yourself. And if you have an open-minded doctor or nurse practitioner that can order this test for you, that would be more ideal. Okay, but this is something that none of us learned in our professional training. Okay, so I didn't learn this in my professional training. I learned this because I was paying attention after I became a doctor, right? Okay, so, and I was listening to the world's leading experts rather than to what the medical societies and what the agencies were saying. Because they are rarely right. They're never right all the time, but they're frequently wrong, whereas the world's leading experts that have had research experience and clinical experience for 30, 40, 50 years, those are the people I listen to because they've been in the trenches, they know what works, they know what doesn't work. Okay, I don't listen to the committees that have political agendas. We should consider that. In all walks of life, we should focus on the people who really know, not people who have a vested interest in us knowing otherwise. Okay, so here's what we do. To get tested for insulin resistance with a glucose tolerance test. That means the glucose, that's blood sugar. Glucose is the same thing as sugar in your blood. There's all kinds of sugars in the blood. That's why in medicine we call it glucose, because that's a precise type of sugar that we're measuring. And we're going to measure that at fasting. That means before you have anything to eat or drink. So you got to be at the lab early. You got to be first in line. I tell my patients, make sure that you call the lab and let them know what you're doing so that they're ready for you. And then go first thing in the morning and at the time that the lab is going to be the least busy, right? On the time of the week, the lab is less busy. And then be first in line. Get there early. Get there before they open so that you can be first or second in line. And then they're going to draw whatever amount of blood they need for all the other tests that you're measuring. Okay, but if you're only doing this test, they'll do 2 vials. They'll do a glucose vial, and then they'll do a different vial to measure your insulin. And then they'll give you a 75-gram glucola drink, which is very similar to a sweet Sprite. It's a carbonated drink. It's like drinking a medium Sprite. It's the same amount of calories and amount of glucose as a medium Sprite. Some of my patients say, no, I could never do that. I can't handle that much sugar. And so, says, can you eat a cup and a half of white rice, some mashed potatoes? Yeah, and that'll do the same thing. some people say, I would never drink sugar, but we'd eat a whole big plate of mashed potatoes and white rice, and that does exactly the same thing, unfortunately. Right? So now at least the mashed potatoes and the white rice has a few nutrients in it, even though it's a refined product. At least it has some nutrients in it, whereas a Sprite has absolutely no healthy nutritional value. It has nutritional value, but on the negative side, right? It's what we call hypercaloric malnutrition. You're getting a lot of calories, but it's actually using up nutrients that you need rather than giving you nutrients that you need. So you do that. You do either a food tolerance test or a glucose tolerance that the lab has there for you. And then half an hour later, they'll check you. I don't have that up here, but usually we include a half hour. So if you're focused on preventing, if you're focused on just screening, if you don't already have diabetes or full-blown pre-diabetes, then you probably don't need the half-hour reading. But if you've never done this before, I would include the half hour because that's the most likely elevation that you're going to see. And then a half hour later at the 1 hour mark, all these times refer to right after the beginning of the drinking or the eating of the food. So whenever you check your blood sugar, if you check your blood sugar later on after a meal, you always count the time from the beginning of the meal, not the end of the meal. The beginning of the meal, the beginning of the drink. And so then, I always tell my patients, this is a hassle of a lab to do, but it's worth it. I've done it 12 times myself. It's really worth it. And you don't have to do it 12 times. I'm just a research junkie. I'm always interested in what's going on. But all you have to do is do it once, and if you find that there's a major problem, you can maybe repeat that after 6 to 12 months to see how you're doing. So then you need to be around the lab. You don't have to stay in the lab, but you can't go walking. You can't go shopping and run errands. You got to stay put. No exercise during that time because the test requires you to be resting, okay, sitting down or standing, okay, and then you check it at 1 hour. You get checked again at 2 hours, at 3 hours, and at 4 hours. Now, some of us, up to 1/3 of us, will notice around sometimes the 2 hour mark, but usually the 3rd hour and sometimes the 4th hour, oftentimes the 4th hour, you start feeling kind of woozy. Start feeling a little lightheaded, okay? Because what's happening is that as that sugar, that basically like you're just eating dessert for breakfast, right? Okay, so that sugar just floods your system. And if your body is resistant to insulin, and now you have to make a lot of insulin to correct for it, that extra insulin now, eventually, after 1, 2, usually 3 hours, is now driving your blood sugar lower than it should be. And that's what we call reactive hypoglycemia. And so that's why I strongly encourage my patients. I never say they have to do these tests. I'm not in charge of their health. They are, right? Each one of you are the chairman or the chairwoman of the board of your own health. Nobody else should tell you what to do. Nobody else has the right to mandate what you do with your body. You have the exclusive right on what happens to your body, and you're in charge. Our jobs as doctors and educators and nutritionists is to give you information, kind of like we're sitting on your board, but you make the decision. You're asking each of your specialists and experts on your board, what do you think about this? And we all tell you what we think, and then you make the decision on what makes the most sense to you. You're in charge, you're responsible, and culpable for that decision. Okay, so never think that your doctor's in charge of your health, because your doctor is not in charge of your health. They can't be, because they're not the ones making most of the decisions. Subtly, you are the ones making the decisions. So we want to make sure it's a good decision, and you're aware of all the facts so you can make the right decision. So along the way, when you're doing this 4-hour glucose tolerance test, you start feeling woozy or whatever, about 1/3 of us do, and that means your blood sugar is starting to crash, and that's activating your amygdala to say something's wrong here. The blood sugars keep dropping like this, the brain's going to shut down. and literally your brain begins to shut down compartment by compartment. I tell people, take a book to read. For some people, it's the only time they can actually sit down and read for a couple hours because they have young kids or whatever. They just don't have time to read. So especially for young mothers, I say, do this test, because these are the same tests we do for pregnant women too. So I said, go to the lab. You have 3-4 hours to hang out a lab, and you can read. Just have your husband or somebody else take care of the kids, and now you have time for yourself for all morning, right? And so, but read. And as they're reading, about the 3rd hour mark, a third of my patients would say, wow, I read that page, and I completely forgot what I just read. You go back and read it again, and I still can't remember what I just read. That's what we call transitory dementia, brain fog. Do you remember I said earlier that most dementia is transient? We're under the influence of something that's causing the poor memory. So when the blood sugar drops like that, your brain is not working properly, and you're actually destroying memory cells. So that's a major clue. Now, the good news is we know how to reverse that. We know how to prevent that. And so now you have multiple tools available to you, strategies available to you to prevent and reverse these considerations. So during that time, we're also measuring your insulin at fasting before you have the drink, 1 hour after you have the drink, and 2 hours after you have the drink. So now we can compare your insulin levels to your blood sugar levels. So, and I'll show you exactly how to do that here right away. So now, I said earlier that you can actually order this test on yourself. There's many ways to do this. One simple way of doing this is just going to ultalabtests.com. ultalabtests.com. So if you're not sure of the spelling, just Google Ulta Lab Tests, and this will come up. And you can basically order any lab test you want that's available at Quest Diagnostics, which is one of the 2 biggest national labs in the country, along with LabCorp. Okay? Now, LabCorp, just a few months ago, after 35 years of me ordering the 4-hour test, now they're telling me we can't do the 4-hour test. But they have no good reason. It's just somebody at corporate decided we're not going to do the 4-hour anymore. And now it's not under computer system. And if it's not under computer, it doesn't exist, right? And so even the lab techs, the phlebotomists that have done it for years, they can't even do it because it's not under computer. So that's why now I'm sending most of my patients to Quest, because they're still doing a 4-hour test. And that 4th hour is oftentimes the only time that we see the blood sugar dropping precipitously. So I like to have that 4th hour to see if there's a tendency to that low blood sugar. And remember, low blood sugar is one of the dementigens that cause us to lose memory or lose cognitive function or feel bad or get frustrated easily or be irritable. Anybody ever feel irritable? Yeah, okay. Don't be too eager to raise your hand. Okay, so the bottom line is you can order any of these tests that you want, and so I'm showing you exactly how to do that. All right, so you can also look up more information about other labs. If you go to my website, Youngberg Clinic, it's just dryoungberg.com. Go to the Services tab, okay, and on the Services tab, the drop-down menu, go to Labs, click on Labs, and you'll see downloads. In fact, I have a download of the first 2 chapters and the full chapter on ordering labs in my book, Memory Makeover, How to Prevent Alzheimer's and Reverse Cognitive Decline, has all the labs in it. This document has 11 pages of instructions of what I'm going to go through next, showing you precisely where you're at. Okay, precisely where you're at. And so we're going to take questions at the end. I'll take all the time we need for questions. So as you can see here, there are 10 stages of high blood sugar. And I showed you here that stage 3 is the beginning of pre-diabetes with a fasting blood sugar of 100 or higher, a 1-hour blood sugar of 160 or higher. That's not officially diagnostic, but it should be, because it's the most sensitive of all the tests. It just doesn't happen to be considered diagnostic right now. The 2-hour test is diagnostic. Anything above 139 or 140 plus is pre-diabetic. And then stage 5 is the beginning of full-blown diabetes, not borderline. Okay, it's actually already crossed over into diabetes with a blood sugar fasting of 126, a 2-hour blood sugar above 200, or a hemoglobin A1C of 6.5. We're going to be looking at this graph here in a little bit some more. Here's the QR code, okay, on the middle right. That if you look at that QR code, that'll actually take you right to my website where you can download free this 11-page document that I'm going to be going over with you next. Okay, so all right, so let me just walk you through now interpreting your glucose tolerance test, and then I'm going to show you how you can figure this out and do this at home even without testing this way. Okay, so bottom line is, and I'm going to go ahead and read this for you. The next thing that we do after we do the glucose tolerance test with insulin is determine how much insulin your pancreatic beta cells were able to produce in order to prevent a further rise of your blood glucose or sugar. Optimal glucose and insulin ranges that are discussed here are based on my experience and my reading of the literature. And I've been doing this on almost every patient for 35 years. So if I know anything, I know about this, okay? So sometimes people question me, well, where's the evidence? Well, it's called 35 years of experience talking to the world's leading experts on this topic, okay? So if you trust me on anything, trust me on this. Okay, so the bottom line is that a fasting insulin level, okay, is measured after an overnight fast before any calories are consumed for that day. The minimum goal for this insulin level is below 10. This is microunits per milliliter. You want it to be below 10. This is data that has been published for over 30 years by some of the world's leading endocrinologists. It's not a number I just pulled out of the hat. So this is well documented by top endocrinologists that consider themselves preventive endocrinologists and so forth. So it's well established it should be at least under 10. But actually, the recommended level is under 7, with optimal goals of less than 5. But here's the catch. You can't properly interpret your insulin level at any time point, fasting 1 hour or 2 hours, unless you first also know what your blood sugar or glucose was at the same time. That's critical to understand. Because without both of those, you really don't know what's going on. So I heard a great lecture by a cardiologist recently, and he said my insulin level was 4.6, and I was told I was a type 1.5 diabetic, which means he has an autoimmune diabetes, a latent autoimmune diabetes called LADA, L-A-D-A. And now he didn't tell me at the time what his actual blood sugar was. And so I talked to him afterwards, and he says, oh, my fasting blood sugar was 135. So it was I'm going to go back to that. A fasting blood sugar of 135 places them at the high end of stage 1. It's the initial stage of diabetes, so he's not in advanced or critical or severe form of diabetes, okay, but he's actually living really healthily. He's fit, he's exercising every day, he's eating a plant-based diet, and he's still struggling with a fasting blood sugar of 135 at the upper end of diabetes, stage 5, but his insulin level is less than 5. if all I knew about you was that your insulin was less than 5, and I knew you exercised every day and you had a really healthy diet, I'd think, oh, you're good. You have an ideal insulin level. But then I hear the rest of the story. No, his blood sugar is now in the diabetic level. That means that his pancreas has lost the majority of his ability to produce insulin. He's still producing insulin, but at a very low level. And in his case, it's not primarily because he's on a bad diet or he's unfit, because he's both fit and on a good diet. There's something else causing it, and the clue is that it's an autoimmune condition. So I said to him, did you actually get your diabetic antibody test done? He says, yeah, no, nobody recommended it. I go like, well, we need to understand. So he needs to do the GAD65 antibody, which is the main antibody that's elevated when the pancreas is being attacked by the immune system due to an autoimmune condition. There's the insulin antibodies, there's the islet cell antibodies. There's at least 3 antibodies that should be measured in anybody who has a latent autoimmune diabetes or a type 1 diabetes. So we see what's going on. And that helps people understand this is an autoimmune condition, meaning what? Meaning that we need to be aggressive at addressing what are the underlying causes of autoimmunity, whether it's arthritis or lupus or whatever. And the majority of the time, in fact, I would say 99% of the time, an autoimmune condition is driven by 2 things: toxins and low-grade infections, or maybe even high-grade infections. And who's looking for those? Very few doctors are looking for those. And so we got to look for this. We got to help the body optimize the immune system. See, when you have an autoimmune condition, a lot of doctors say, well, we don't want to increase the immune system because you already have an autoimmune activity, and we don't want to stir that up more. That's wrong. That's wrong. No, if you have an autoimmune condition, that's because the immune system's trying to address a toxin or an infection. So what you do is you optimize the immune system's ability to get rid of the toxins and to fight the infection. That's what we do. Okay, so in other words, we got to consider all the factors, and that's discussed in the 20 strategies in this handout. So take advantage of this handout. So we're first assessing how high is the insulin and how does it compare to the blood sugar. Okay, then, so for example, if your insulin level looks ideal, but your blood sugars are even slightly elevated, they're just a little bit elevated. Maybe they're like 95. I had a patient recently who had a blood sugar of 90, okay, of 90, which is in the middle of stage 1 fasting, and but his insulin level's really low, under 5. And so it didn't match. He should have been producing a little bit more insulin to try to bring that blood sugar down, but he wasn't. That means that there's some defect in the ability to produce insulin right away, and even though his insulin and his blood sugars were nowhere near pre-diabetic, it was showing there's a problem. And his main problem is he had a heart attack. He was fit. He had a healthy diet. Something else is going on. We need to figure out what that is. Okay, so more on that in a bit. Okay, so bottom line. Okay, so now we go to the 1 hour blood sugar or insulin. Okay, so 1 hour insulin is measured 1 hour after initiating the 75-gram carbohydrate drink called the glucola, or your own meal if you prefer, which is roughly 300 calories of pure carbohydrate. The goal for insulin at 1 hour is to be less than 30 microunits per ml. Okay, so these are going to come in your lab. So I'm basically teaching you how to interpret your own lab that you're ordering for yourself, right? So if you can't get this order through your doctor, just do it yourself, right? I'm giving you all the data how to do it. This is what I do for my patients, exactly. Same process. I'm telling you right now exactly what I tell them when I work with them. Okay, so you want to be at least under 30. Now, this is assuming a normal or near normal blood glucose. If your blood sugar is higher, then, if you're in stage 2, stage 3, or higher blood sugars, then you better be producing more than 30 microunits of insulin per milliliter, or else that means that you're really have advanced damage to your pancreas, right? So we got to consider all these factors. So any increase above optimal insulin levels at any time point is associated with a continuum of potentially increasing risk for high blood pressure. Over 50% of all hypertension, of all high blood pressure is due to this, okay? For weight gain, because if you're producing a lot more insulin to try to control blood sugars, what does insulin do? It stores fat. It stores sugar into fat. It stores, you gain weight. That's why a diabetic who just is taking more and more insulin to try to control their blood sugar, what that does, yeah, it helps control their blood sugar, but it is causing them to gain weight all the time. Okay, so it's not a real ultimate healthy way to control blood sugars. So it is one of the main cause of infertility. Well, more recently, there's been other causes of infertility because of COVID and things associated with COVID. Okay, but infertility is a major issue for both men and women. There's major problems with infertility now, and especially in the last few years. But historically, the number one cause of infertility was insulin resistance. I actually ran a fertility clinic with the OB department for 7 years in Guam, okay, where women who were trying to get pregnant, okay, would be referred to me by their obstetrician gynecologist, and I would actually have them do a glucose tolerance test, okay, and in fact, the obstetricians wanted to put them on metformin, which actually improves insulin sensitivity, but I had better options for them, so very few of them ended up needing metformin to lower their blood sugars or lower their insulin resistance. And we had wonderful success helping women who were trying to get pregnant, could not get pregnant. Now we're able to get pregnant just because we're improving insulin sensitivity. Quick story, you got to hear this. I had a young lady while she was in her early 30s. She already had 4 children, and she'd been trying to have her 5th child. She wanted 4 kids, and she'd been trying for that 5th kid for 5 years, and she could not get pregnant. And so she was happy she had 4 kids, but she wanted that 5th kid so bad. It was just one of her goals. And so she came to me and she says, I'm desperate when I have a 5th kid, but I know I'm not healthy right now. I said, when do you want to get pregnant? Because I know this works really well. And she says, I want to get healthy. I want to lose some weight first. It's maybe in about a year, but I want to start working on it now. And so I looked at her and I said, Judy, not her real name. I said, Judy, you need to understand something. As soon as you start doing what I'm doing, you're probably going to get pregnant unless you're using some type of protection. And I could tell that she was thinking like, yeah, right. I've been trying so hard to get pregnant for 5 years. I don't think this is going to happen overnight, right? And so I've seen that look before, and I said to her, I said, I'm serious. I'm serious. You could get pregnant within the next month or 2 if you do what I'm suggesting to reverse your insulin resistance. And again, she smiled and appreciated my comment, but she just simply did not believe that it was going to work that quickly. 4 weeks later, I come into my exam room where she's sitting, and she's sitting there like this. So I came down and sat next to her, put my hand on her, I said, what's going on? And she looked at me, and she said, don't say I told you so. And so I said, you're pregnant, right? And she said, yes. And so I said, but she was happy. She was overjoyed that she got pregnant. She was just disappointed that she hadn't had the chance to get healthier to get ready for her pregnancy the way she had envisioned it originally. And so that's how powerful reversing insulin resistance. It improves everything. It lowers your cancer risk. It lowers your dementia risk. It lowers your heart attack risk. It lowers every risk, autoimmune risk, except for infertility, certain cancer, stroke, etc. So high insulin levels, even if blood sugars are optimal, okay, so even if on that full 4 hours of the testing, your blood sugar never goes above optimal. But if your insulin levels are high, that's your first major sign there's a problem. Okay? And that would be a great place to start, right? Because most people start when their blood sugars are sky high and their insulin levels are low, which is the final stages of the problem. And even then, there's hope, but the earlier we start in reversing this process, the better. So even when high insulin levels at any time, before or after meals, suggest tendency to insulin resistance, which is a major risk factor for many health issues. However, insulin resistance and resulting high insulin levels can be reversed and improved through consistent lifestyle and nutritional strategies, and expanding our thinking beyond just these few health-related issues and looking at toxins, infections, optimizing the immune system, doing everything to fix the underlying problems. Okay, so when blood insulin levels are lower than normal, but your glucose levels are high at any time after eating or drinking carbohydrates, this indicates a loss of pancreatic function, where the insulin-producing cells have been damaged or reduced in number. Okay, and now they are unable to produce enough insulin to even moderately control blood sugar levels. Very low insulin levels, that means close to zero or much lower than it should be, after consuming any starches or fruit or carbohydrate-rich foods, suggest the presence of type 1 diabetes, representing complete or near complete destruction of insulin-producing cells in the pancreas. Okay, and then, I've already explained that part. All right, now, so number one, I'm encouraging you, do it yourself. Order it yourself. Get online, be proactive, order this test, and you can even, if you're not sure exactly how to do this, you can call my office. The contact information is on my website, dryoungberg.com. You can call my office. And Erica, a wonderful Hispanic lady who was my oldest daughter's best friend. She's now works for us. She'll explain. She talks Spanish, of course, okay, and English, and she can explain all this to you if you have any questions. You don't even have to see me as a patient. She'll help you with that. I just want you to take advantage of this. This is so important. Now, that means that you're in charge of your health, right? We already went over that. And now, this is a really important story to kind of showcase how this works. This is a picture of myself and Mr. Tom Zapara, who has basically spent millions of his dollars, donated millions of his dollars to Southern Adventist University in a scholarship fund. He has given millions of dollars to almost every educational institution in our church. He paid for the entire new business school at La Sierra University. He's donated millions of dollars to Loma Linda University, School of Medicine, and other institutions. And he was the chairman of the board of my publishing agency that published Goodbye Diabetes. In fact, I would have, so this is a picture with his daughter who was studying to be a chaplain at the time. So here's the book that Mr. Zapara commissioned to be published. He's the reason that I wrote this book. He had a family member who had out-of-control diabetes, and he says, I would like to see a book written that focuses on all the natural and lifestyle medicine principles on how people can reverse their diabetes and be able to say, goodbye, diabetes. It's over. Let's get rid of this. And so it was he the one that commissioned. He harassed my publisher for 5 years, who harassed me for 5 years, and we finally got it done. Okay, and it was actually Elise Harbolt, my cousin's daughter, okay, and some of you in this room know her grandfather, Dr. Russell Youngberg, and know the whole family. It was Elise Harbolt, my cousin's daughter, who was my co-author. And she graduated from Southern Adventist University here, and right after graduation, she came and helped me write this book. An amazing writer. All right, so here is a video, just a 2-minute video on Mr. Tom Zappara talking about what happened, and I'll tell you the rest of the story.
You know, about 3 years ago,
Turn
I
it
read
up.
this book by Youngberg, Goodbye Diabetes. And lo and behold, a year later, I'm going in to get my routine medical test. My doctor informs me that, lo and behold, I was a full-blown diabetic. That just scared the liver out of me, you know. That was like a death sentence to me. I didn't say a word, and my thoughts was going, I've got to do something. So I had two choices. I either had to take insulin or eliminate diabetes. Just common sense tells me, isn't it better to eliminate this instead of fighting it all my life? And I determined to give that a try, praying to God to give me the resolve. I'm not praying for God to give me good health. I'm praying to God to give me the resolve so I can develop my own good health. And since then, by having a very substantial breakfast of like different berries and greens in a smoothie and a big bowl of fresh oatmeal, and I walk 6 days out of 7. And because of that, my heart medications are virtually, and cholesterol are virtually at 0 now, and I'm thinking that's probably going to be off pretty soon, off completely. I lost 40-some pounds. I have more energy, even though I'm getting older. My next goal is to get to be 100. One of my hobbies is wood turning. I'm in the process of making about 100 bowls and vessels, and I'm going to have a big party. I'm reluctant to give anybody advice because everybody really doesn't like advice. All I think I would encourage people, educate yourself more about just standard health, about different things, and you just have to come to your own conclusion there. And I think somehow you'll evaluate your own health. I'm Tom Zappara, and I'm 91 and a half years old.
And that's the word from the chairman of the board. He not only was a real chairman of the board in his profession, but he became the chairman of the board in his own life as well, and that made all the difference. This is he was the chairman of the board of our publishing house, and so he got the first copy of the book, Goodbye Diabetes. His publisher, Mr. Dan Houghton, brought the book to my home and had me autograph it and personalize it to Tom Zappara, and then he took it to Laguna Beach, to a gated community overlooking the Laguna Beach Bay, and presented it for Tom. Tom read it cover to cover in a couple days, and he read the section on labs, and he read about everything that was going on, and he was reading about what we've been talking about this morning. He'd go like, whoa, I better get tested. He says, if a full 30% of individuals over 75 have diabetes, and 75% have at least pre-diabetes, and I'm 89 years old, then I better get busy and start being chairman of the board of my own health. Because up to that point, he just go see his cardiologist and go see his primary care physician, and everything was okay. He wasn't super healthy, but he wasn't sick either, so he was okay, right? And so he read the book. He says, so he calls me up. He goes, Doc, I need to get tested. I go, great, let's do it. That's kind of what I wanted to hear, right? And he was now motivated, and so I filled out a lab form for him, faxed it to him or emailed it to him. He printed it out. He went to the lab right there in Laguna Beach, and like all my patients do, all the labs are done wherever they live, and got the full 4-hour test done, got all the other labs done, and then had his limo driver bring him to Temecula, which is halfway between Loma Linda and San Diego, and came to my office, and let me go over his glucose tolerance test right now with you. Look, his fasting blood sugar was 144. Okay, that's already in the advanced diabetes category. That's stage 6, high blood sugars. Okay, and so he already had diabetes just from that one indication. But we wanted to see what was going on after he had that sugar drink. So he had the sugar drink, and boom, his blood sugar jumps up to 261. And at 2 hours, it even went higher, which means what? Which means that there was a delay in that blood sugar getting up there. Okay, so most people have the highest blood sugars at 1 hour, and then it comes down at the second hour. In his case, it was the reverse. So at 2 hours, his blood sugar is already above 300, and he didn't even know he had diabetes. Okay, so he had no idea. So this had been going on for decades already. So if he was like you, who are now thinking, I need to get these tests done, if he had done that test 20 years earlier, he would have seen the problem, and he would have prevented all that from happening. It would have improved his cognition. It would have improved his neurologic health. It would have improved his stamina, his overall cardiovascular health, and so forth. He would just felt better. He kind of had a reputation for being grumpy sometimes. Does that happen to some of you? Happens to me once in a while. My wife has to remind me, you're being grumpy right now. Is your blood sugars kind of low? I go like, oh, maybe. And so that's because I'm not doing the right things to prevent the low blood sugar, right? So it reminds us to get back onto the program. So look, even at the 3rd hour, his blood sugar is almost 300. By the 4th hour, I never saw the big dip on him. I would have had to gone maybe to 6 hours before we saw the dip, and I'm not going to do that. And his average blood sugar at the time was 7.1. Now, that surprised me a little bit. If you know anything about diabetes medicine, I would have expected his hemoglobin A1C to be higher than that. But clearly, we saw a huge problem with his blood sugars, clearly out of control diabetic, and he was 89 years old. And look at his insulin levels. His insulin levels are actually, if we didn't know about his blood sugars, we'd say, well, they're a little high, but not that bad. But now we look at his blood sugars, and they're really bad because they're way inadequate to try to control the blood sugar. You see that? The low blood sugars here, these blood sugars are more than double what they normally would need to be, but even that doubling of insulin production is nowhere able to control the blood sugars, as you can clearly see. And so that shows that the ability of his pancreas to produce insulin is already highly compromised. He's already lost probably 95% of his ability to make insulin. Okay, but there's still hope. That's the whole point. Even somebody at his age and at his level of pancreatic dysfunction, he can turn that around. And I'm going to show you what he did. So 5 weeks, so he was in my office with his wife, and his wife kind of was like, I don't know what all this fuss is about. She hadn't read the book. So she was kind of thinking that this was a waste of her time, right? But Tom was motivated. It's like, oh man, what are we? So I'm going over the blood test, and I said, Tom, you're diabetic. And he goes like, what? What? I said, Tom, you're a full-blown diabetic. And he's typical chairman of the board. He took his hand and slammed it down on the boardroom table we were sitting on. And he says, "What are we going to do about this?" And I love it. I love the passion, you know. And I looked at him and I smiled. I go, "I'm glad you asked, Tom." It's exactly what we're going to talk about next. You know, so he was like, let's get on with this. You know, he's not, "Oh, well, I don't know what I should do. Maybe we should do some more tests, or I need to get a second opinion." I mean, you know, this is all the opinion you need. This is information coming from your own blood. It's not what I'm thinking. I'm just telling you what it means. I'm just interpreting it, right? And so he didn't get into any of that denial thing. He immediately went to the crux of the issue. He says, "What are we going to do about this?" Typical chairman of the board. "Let's get to it, man. This is business, man. We're losing money here. Let's make some money right now." And so we immediately got to, what do we do? Cause and effect. And so I kept it real simple, and I'm going to go over the steps with you in a little bit. We started talking about the initial strategies of how to optimize the diet and how to optimize. You saw in the video how he was exercising with his wife every morning after breakfast. When I suggested that he should go walking after breakfast and most meals, his wife scowled at me. She said, "Did you see how he was walking and how unsteady he was, just walking from the main clinic across the hall to the consulting room that we're in now? Did you see how unsteady he was? He was kind of walking, you know, he needed to kind of stabilize himself." She said to me, when he's walking down the hall in our Laguna Beach home above the beach, he's doing this. He kind of pushes against this wall of the hall, and then he bounces off this side of the wall, and he bounces like a pinball, okay, down the hall. He says, he can't go walking. And so I said, "Vi, that's why you should go walking with him and hold his hand." She scowled at me some more. But she did it. You saw her on the video. Every morning, they became the talk of that entire gated community. There was a 1.8-mile loop around that gated community overlooking Laguna Beach. And so, in fact, I'd have people call our office and, "Man, we love this older elderly couple that's always walking around. Everybody's asking, 'What are you doing?'" And 5 weeks later, Tom calls me up. He goes, "Doc, I want to get tested again." And I said, "It's only been 5 weeks, Tom." And he says, "I know, but it's my 90th birthday next week, and I want to be able to tell them how I'm doing." In 5 weeks of doing the program, of implementing the things I'm going to show you, he reversed his type 2 diabetes. 5 weeks. Now, I'm not saying everybody can do it in 5 weeks, but I am saying that an 89-year-old, 1 week before his 90th birthday, did. And don't think that that only lasted a couple months, because I'm going to show you here it lasted 11 years until he reached his goal of being 100 years old. In fact, he made it 1 year better than that. Last year, I was at his memorial service. He lived to 101. And a couple months before this happened, I visited him at his Laguna Beach residence, and he leaned over to me and said, "Wes, I love you, man." that meant a lot to me. You know, he had said to me, he says, "I'll do anything for you." You know, he's a gajillionaire, right? And, of course, I did not abuse it. I never asked him for anything. He said, "I'll do anything." He said, "Tell me what you want. I'll do it." And I said, "You know what? Just let me tell your story." I said, "Let me tell your story, because you can be an influence to thousands, if not hundreds of thousands of other people who think, maybe I'm too old. You know, I'm 65 in a couple months. Maybe I'm too old." Don't use age as an excuse. Think about Tom. He did it at age 90, and he kept it up until age 101. Never think that you can't dramatically improve your health. It has nothing to do with age. It has to do with your willingness to do what it takes. That's really important to understand. And that's great news, isn't it? So none of us are too old. None of us are too infirm. None of us are too sick. We can all really improve. And so let's look through this real quickly. So within 5 weeks, Okay, so he actually saw me. He saw me about a week or so after these tests. 5 weeks later, his blood sugar is 107. He's no longer diabetic. His hemoglobin A1C is 6.2. It had dropped under 6.5, so he was not diabetic by either criteria anymore. And so, so he'd already reversed his diabetes. And then the next step is, well, we're going to reverse your pre-diabetes now. So like, I'm all into it, he said. So he kept doing his walking after meals. He kept focusing on a healthy diet. We looked at other factors, did other tests, and he just kept incorporating what we found on his lab tests. And then you see, he was still kind of in that pre-diabetic range, up to about a year later. 5.6, 5.7. That's right there, borderline pre-diabetic. But then about 2 years into his program, we had never once talked about weight. You saw in the video, he talked about losing 45 pounds. He actually lost all the 65 pounds he needed to. We never once talked about weight loss. Not once. Why? Because that'll take care of itself once you're on the right program. Okay, it's not about losing weight. It's about getting healthy, and then the weight just comes off. Okay, if it needs to. Okay, so you see about 2 years into it, now look at his hemoglobin A1C now. 5.1, 5.2, and it stayed that way for 10 years. It never went up. Why? Because he maintained his consistency. So oftentimes I hear even doctors saying, yeah, but how long are you going to keep that up? After 6 months, people just give up and they don't do it anymore. That's because you're not giving them the tools. You're not helping them understand what's really going on. Okay, and so Tom proved to us that at any age, you can reverse your diabetes and you can keep it reversed. Now, let me make a comment on this. I'm not suggesting that everybody is able to apply the same strategies Tom did to fully reverse their diabetes. There's some of us that are not going to be able to fully reverse the diabetes, and it has to do with how much damage has been done to your pancreas. That's the primary. That's why we measure it in the glucose tolerance test, the way we discussed. Now, what about you? What if you're not fully able to reverse your diabetes? Does that mean there's no hope? Absolutely not. In fact, I will go as far as to say that the main goal is really not to reverse the diabetes. The main goal is to get healthy again. That's the main goal. And you can even do that and still be diabetic. Okay, you're optimizing your health. Okay, so the main goal, so it's not all about blood sugars. We've been talking a lot about blood sugars this morning. It's important, but if you're in one of those situations where even after applying all the strategies, your blood sugars are still running high, the issue is if you're on the right strategies, you're going to be healthy, because it's the strategies that make you healthy. It's not just the improved blood sugars that make you healthy. Do you understand that? That's really important to know. It's the Mayo Clinic 10 years ago did a major study, and they said we have made horrible mistakes of suggesting that it's only about blood sugars, because health is way more about than just blood sugars. It's about other things too. It's just important for us to understand, especially early on, how blood sugars help motivate us to get healthy again, right? Okay, so that's the story of Tom Zappara. So what we're looking at is, how do we determine the potential for reversal? We just addressed that by looking at ordering your own glucose tolerance test with insulin levels, and then getting that interpreted properly, okay, to see where am I in this continuum of optimal, early pre-diabetic, advanced pre-diabetic, early diabetic, advanced severe diabetic, etc., and how well is my pancreas producing insulin or not. Okay, and then what are the key strategies for effective reversal? So let me jump into strategies on how to do that right now. Okay, so I'm going to skip through these. They're interesting, but I'm going to skip through this. So basically, our 3 goals of intervention. Number 1, slow down progression of the disease. That's first goal. Start slowing it down. Number 2, stop the progression of disease. And then number 3, experience improvement in function, thus initiating reversal of the disease pathology process. That's true with all chronic disease, dementia, diabetes, heart disease. All of us can initiate slowing down, stopping progression, and reversing that process. Okay, so the first step is check. So even once you've done the glucose tolerance test, now you want to put it into practice. And so the most important thing, in my opinion, that you can do, and this is based on my 35 years of experience clinically, is start checking your own blood sugars any way you want to do it before, 1 hour, and 2 hours after the beginning of every meal. Now, you can do that with the old-fashioned, basically pricking your finger and to get a little blood sugar on the glucometer. You can do it that way. That's the way we always used to do it, and it works really well. Okay, check on the side of your finger, not your fingertips, because your fingertips have all the nerves on it. You can feel that. Okay, but the sides of your fingers have very few nerves, and therefore you're not going to constantly feel the little scabbies after you prick your finger if you do the fingertips. Okay? Okay, so that's one way to do it, and I practiced for decades helping people do that, and it's revolutionary. They are able to learn instantly when you eat this and when you don't exercise, your blood sugars shoot up. And when you exercise even lightly, immediately after a meal, blood sugars come down dramatically compared to not exercising. So there's all kinds of strategies that can be followed. So bottom line, start checking it. What I am now recommending my patients is that they get a continuous glucose monitor, a little tab that sticks on your upper arm and your shoulder that basically lasts roughly 2 weeks, 14 days. You can get those over the counter now. You can get what's called Stelo, S-T-E-L-O. Stelo is put out by Dexcom, and it's an over-the-counter, a direct-to-consumer brand of continuous glucose monitor. So you can order it online, and you can get, for $99, you can get a 2-week tab that will give you continuous reading of your blood sugar night and day for 14 days. Okay, so that's one option. The other option, which is an even better option, is to ask your doctor to write you a prescription for the Dexcom 7. That's the most accurate of all continuous glucose monitors. It requires a prescription, but it's one of those best-kept secrets. Most doctors won't think about prescribing it to you because you're not a type 1 diabetic. Most of us aren't, or you're not somebody that's on high doses of insulin. The insurance will only pay for this is if you're on a high amount of insulin or you're type 1 diabetic. And even then, it can take you a year to get it. Okay, so don't play the insurance game. If you're having a hassle getting it, just do it yourself. Get the Stelo. Okay, order the test yourself. Don't wait for this to be covered by insurance because that's a game that you might lose, right? So just take care of your health. Don't worry about the insurance part. You can get major discounts in all these labs when you order them through Quest, through the method I mentioned earlier, like 85% discount. So it's really worthwhile to just do it yourself. Now, if you can tell your doctor, say, I know I don't qualify for insurance, but just write me a prescription anyways, and then I'll pay for it. That way you'll have access to the most accurate method, especially if you have problems with low blood sugars. The Dexcom 7 continuous monitor gives you a reading of blood sugars all the way down to 40, where the Stelo only goes down to 70. So I would prefer the Dexcom 7 for people with low blood sugar or super high blood sugars above 200. Okay, so do one of those 3 methods, start checking. So next step. Okay, we're ready. You've already hopefully downloaded this document. You know how to download this document that goes over all of this information. Okay, and so the next step is for 2 days, continue to eat like you normally eat. Okay? You know, some people, for a couple weeks before they go to the doctor to get their yearly labs, they like fast for like 7 days, because they want to make sure, they want to give the best possible results when they see their doctor. But who are you fooling? You're basically harming yourself when you do that. Let's find out what really happens in normal everyday lifestyle that you have. So eat the same thing that you always eat. Do not change anything. In fact, don't even exercise at all in a significant way during those next 2 days. And I want you to see the impact of your normal diet without exercise on your blood sugars fasting 1 hour after the beginning of the meal and 2 hours. And just keep simple notes about that so you can go back, oh yeah, that's when I ate this. Oh man, my blood sugar, many people have never checked their after meal blood sugars. All they know about it was their once a year, their physical, and that's their fasting blood glucose. That's not good enough. That's very insensitive. You could have a blood sugar above 200 at 1 hour and have a perfect fasting blood sugar. I see that all the time. Okay, and those are early clues that something really bad is going on that we can reverse. That's the point. Okay, so the first step is just check your blood sugars. And then also, you document all this, but include party meals. Okay, in other words, let's stress the system a little bit. Let's do a little bit of kind of our own glucose tolerance test at home. I used to, for screening in the community, I would do what's called the Pepsi Jelly Bean Challenge. I'd have them eat some jelly beans or drink a soda or drink some juice. I'd have my college students that I taught and my graduate students, I'd have them do I'd just have them bring their favorite drink, whatever that is, whether it's a juice or a soda, whatever it is, and then either some cookies or some whole wheat crackers, whatever they normally eat as a snack, and that's about 300 to 400 calories of carbohydrates, and they'd eat that, and then we check them an hour later, and at least 10% of my college students would always be pre-diabetic or worse. People in their early 20s. Okay? And a couple of them would be full-blown diabetic and have no clue. Okay? Because the 1 hour reading is really critical to know the sooner the better. So check party meals too. And why would we change anything we eat? I hope that you wouldn't do things just because I said so. I'm not that way. I'm not going to change something I like just because somebody says so. Maybe I'm stubborn, and maybe you're stubborn too, right? I think we all are kind of set in our ways, and we're not going to change unless we get some real important information that tells us, I really need to pay attention to this. And so most of us will not change until we see, wow, I checked my blood sugar 1 hour after having that food that I like to eat at least once or twice a week, and boom, my blood sugar is now above 200, above 300. Whoa, okay, now nobody's got to convince me. I'm not having to have faith in what somebody tells me. I'm just looking at what came out of my own blood, and I'm going like, wow, I now have no excuse other than pay attention. I know that this food is really bad for me right now at least. And it may not be necessarily a food that is in of itself bad. If we have major insulin resistance, just having more bread or potatoes or rice, even whole grain, can sometimes be too much for a body to handle. I'm not saying those are bad foods. I'm saying you should eat the foods that work for you, right? I mean, this is all about precision medicine, about personalized medicine. And so how are you going to know? Okay, don't just follow what I say. Figure it out by doing it yourself. Checking and making decisions based on your blood work. So do that. And then what you do is it's the after-meal blood sugar spikes that actually are mostly responsible for the elevated glycosylation and caramelization. Okay, so in other words, just by controlling your blood sugars right after the meal, by a healthy diet and light exercise right after the meal, you can dramatically lower the pathology of diabetes and prediabetes within weeks you can do that, as you saw Tom Zapara do as well. So after 2 days, add in after meal light exercise. And so what we're doing here is, and let me read this, because just light to moderate activity, like just walking normally like this, right after finishing a meal, will lower the blood sugars dramatically. So just start with 5 minutes. Go to 10 minutes. You'll notice that you feel so much better after the meal if you're active, if you're moving your body. And the people who have really high blood sugar, let's say your blood sugar is 200 after a meal at 1 hour, you go like, wow, I need to do something about that. So some people get motivated and they go for a 20, 30-minute walk after the meal, and now the blood sugar is completely normalized or optimized after the meal. It's not 200 anymore, it's like 120. Okay, that's how powerful these strategies can be. And so bottom line is that you want to note the difference between the after-meal blood sugars when walking or exercising compared to when not exercising with the same foods, the same type of meal. Okay, that is really important to understand. We figured out, we used to do this with all our patients. We checked their blood sugars before and 1 hour after the meal and 2 hours after the meal. And if we added exercise immediately after the meal, just light to moderate exercise, not get sweaty exercise, just normal walking around, that would lower the blood sugars anywhere from 1 to 3 points for every minute that you walk or exercise. So if your blood sugars are running 300 after a meal and you walk for 30 minutes, now your blood sugars are 100 points lower just because you walked immediately after the meal. So that means your blood sugars never went up to that 300. They just went up to 200. And after a couple more weeks of doing that, now they're at 150. And they just keep coming down to optimize. So just simple strategies like this have a powerful effect that motivate you. Why? Because you're checking your blood sugars and you're seeing instantly. You're getting instant biofeedback when I do this exercise, when I eat this meal versus this meal. This is what's happening to my blood sugar, and it reinforces that healthy, positive behavior that you've been involved with, and now you're much more likely to keep doing it because it doesn't take 3 to 6 months for somebody to tell you, oh, what you're doing is working. Because by that time, you've given up because it's just too much time. You don't have enough feedback. So this is a very powerful approach for you. So basically, incorporated after a meal exercise. So then after a week or so, add in more intensive cardiovascular exercise. So now that you've seen the power of doing a little bit, 10, 20 minutes or more of light exercise immediately after finishing the meal, not 15 minutes later, not 30 minutes later, not an hour later. Why? What would happen if you wait an hour? Your blood sugar's already peaked to the highest point it's going to peak at, and you've lost the ability to prevent the rise, to prevent that glycosylation, that pathology from happening. So the exercise is still good for you an hour later, but you've missed the opportunity to control that. It's kind of like moving out of the way after the bullet's gone through your heart. Maybe not the best analogy because that doesn't work, right? Okay, but it doesn't help at all to move out of the way after the bullet's gone through your heart. But the idea is you want to address where you get the most benefit, and so that's why timeliness of exercise is really a big part of the benefit, not just whether you exercise or not. But once you've done that light to moderate exercise immediately after the meal, then you want to start incorporating other forms of fitness-related exercise. Going for a walk after a meal helps you with some level of fitness, but nowhere near to the level of fitness that you really need. That's just getting your blood pumping, helps your blood circulate, helps your food digest better, helps control your blood sugars, but it's not really giving you a fitness effect, right? It's good for you, but not good enough. Now the next step is to start getting fit and bring in aerobic cardiovascular exercise like like really brisk walking, so this would be either before a meal or a couple hours after the meal, where now you're going to perspire, okay, or you're actually exercising with a high enough heart rate where you're breathing deeply, right? You're working out. You're exercising now. You're not just going out for a walk. You're putting stress on your heart. You're strengthening your heart. You're improving your muscle tone. You're getting exercise. You're sweating. You're releasing toxins. You're doing all these good things, right? And so the goal is to do that for 20, 30 minutes most days of the week. Sometime, just carve out half an hour or more every day in addition to light exercise after the meals. So it's a different benefit that you get where you're getting fitter, the muscles are getting stronger, the muscles are getting more sensitive to insulin, and now your pancreas doesn't have to make nearly as much insulin to get even better blood sugar control and less tendency to low blood sugar as well. So now you're stabilizing, you're balancing. Okay, so you incorporate the cardiovascular exercise. Remember to do this slowly. Don't get impatient with yourself. You're not going to become a jock overnight, right? You just want to gradually improve your fitness level. Focus on the process. Be patient. Don't overdo it. You don't want to get injured. You don't want to actually depress your immune system by exercising harder than your body can actually handle. So after a good workout, you should feel pleasantly tired. You shouldn't feel like, oh, I'm glad I don't have to do that for another 24 hours. If you're feeling that way, you're doing it too hard. You need to slow down. Okay? All right. So then you want to incorporate muscle toning exercises. Now, some of you are thinking, wait a minute, that's just for the athletes, right? That's just for the jocks. Absolutely not. One of the number one determinants of cognitive function is how strong your muscles are. In fact, it's the earliest indicator of dementia is when your leg muscles are starting to get weak. I'm starting to think about that myself. I'm starting to do some squats now. I'm doing more squats than I used to do because I know the studies on that. If the leg muscles are starting to lose their strength, that's directly proportional to your brain cells atrophying. Okay, there's a lot of reasons for that we can't go over right now because we're almost done. Okay, but we really want to optimize the strength of the muscle because the stronger your muscle is, we're not trying to get huge, we're not trying to be Schwarzenegger, we're just trying to be fit and tone. Okay, and by doing toning exercises, even 7 minutes a day, or 20 minutes every other day, can dramatically improve your metabolism and reverse insulin resistance, independently and separately from the other forms of exercise and their benefits. So all three forms of exercise done moderately and appropriate for your current health status and fitness will be very, very helpful. Okay, then, all right, so if you exercise really hard, you can actually increase your blood sugars. Why? Because you're putting stress on your body, and your adrenals start releasing cortisol, and cortisol tells your liver to dump sugar. So if you notice that your blood sugars are shooting up, just tone down the intensity a little bit. Okay? And it still may be good for you. It's okay for it to go up temporarily. Okay? If you're doing intense exercise, that's appropriate for you. Make sure it's appropriate for you and not getting injured. But be aware of that result of intense exercise sometimes can increase your blood sugar temporarily, but ultimately it will lower your blood sugars. Okay, so if your blood sugar levels continue to be significantly elevated, you can benefit from weight loss. Further restrict breads, potatoes, and other non-bean starches to only 1 serving per meal and no more than 1 total serving of fruit per meal. In other words, evaluate your diet and how it's affecting your blood sugars, and you make the decision based on your results how much of the starch, how much of the fruit your body can handle and still have reasonable blood sugars, right? That will continue to improve. The fitter you get, the more the healthier you get and the more insulin sensitive you become, the more healthy starches and healthy fruits you can consume without having high blood sugars. Okay, so just because a food is healthy doesn't mean that you can eat as much as you want of it. You got to pay attention. And how do you know? How do you know? You test your blood sugars. That's how you know. Okay, so all right, so that's very important. If you're on medications, this is really important. We'll end with this. If you're on medications, make sure to work closely with your doctor to develop a plan to adjust your insulin or your medication right away. Otherwise, your number one risk factor, if you're on a medication and you're planning to implement this strategy, your number one risk factor is having a severe hypoglycemic reaction that would end you up in the ER. Okay? So that's the big disclaimer here. You got to pay attention. That's why if you're checking your blood sugars, you're going to know immediately whether you need to start decreasing your medications. So you need to have a plan devised with your prescribing doctor right away that how you adjust your medication and which medications you start cutting back or stopping first. Because you will need to do that. Okay? Diabetes or prediabetes is not a medication deficiency syndrome. That's just one way to control your symptoms of high blood sugars, but it is not addressing the problem of what caused your diabetes or prediabetes. Therefore, you will have to fairly quickly start getting off of that medication, or else you're going to become sick. You're going to become hypoglycemic, and you end up with a coma, and you don't want that. So I'm being very serious when I say this. That's why while you're checking your blood sugars, you are quickly able to report that to your doctor or your nurse practitioner or their nurse and say, this is what's going on. Which medications should I start cutting back and how much? You need to have a plan to do that. Okay? And remember, you're the chairman or the chairwoman of the board of your health. Ultimately, it's your decision. So you need to have an awareness of how to do that anyways. Okay, so if you're not getting the feedback you need from your doctors, I would rather see you have high blood sugars with less medication than super low blood sugars with normal medication. Why? Because the biggest risk factor is low blood sugars, not high blood sugars. Okay, so as long as you're willing to keep checking your sugars and continue the strategies, you're headed the right direction. Okay, so we're wrapping up here. If you look at the handout, if you download the handout that I'm suggesting from this QR code or my website, you'll see that there's 20 strategies. So we've covered the first 5 or 6, okay? And there's many other strategies that you want to consider as part of natural, simple remedies to optimize your blood sugars, to optimize your insulin sensitivity, to reverse your insulin resistance, and to literally put you on a path of reversing your diabetes, reversing your prediabetes, or at least preventing it from ever happening in the first place. And so the last strategies, there's 4 strategies that I mentioned here about fighting the hidden culprits and the unsung villains of diabetes and prediabetes. So I'll just go to the titles: to prevent and quickly treat all infections. This is really critical, and the most important methods to do that are natural and simple remedies. I'm not saying that you should never use prescription medicines to treat infections. Many times we need to do that. I'm saying that most of the time you won't need them if you initiate these strategies that I'm talking about. And there's many, I have YouTube videos that discuss this in detail. Number 19, optimize your vitamin D level. And this is a new problem that the new guidelines with insurance and the new Endocrine Society guidelines say that hardly anybody needs to check their vitamin D levels now, and very few people need to take supplement vitamin D. both guidelines, which I 100% disagree with. I think they're horrible guidelines. I think they're just really bad guidelines. That's why we should not be following guidelines from individuals that don't necessarily have our best interest at heart. We should be following guidelines from people that really know what's best. Okay, and there's no question that you want to have your vitamin D optimized. Here's an extra tip for you. One of our main goals is trying to prevent this new onslaught of cancer that is just ripping through our communities right now. And an oncologist by the name of Dr. Angus Dalgleish, he's one of the top oncologists in the world, and he's been doing research on cancer treatments for over 40 years. He's 80 years old, still practicing medicine, and he always asked this question: what is it about certain people that don't respond to chemotherapy or don't even respond to immunotherapy? You know that most people don't respond to chemotherapy. You know, everybody talks about, oh, this chemotherapy is so good in treating cancer. The vast majority of people don't respond to it. That means it doesn't work. Okay, and immunotherapy is actually much better. It's a much more logical strategy to stimulate the immune system rather than to try to kill cells. But immunotherapy, MD Anderson, one of the top cancer treatment centers in the world, they actually document that over 30% of people don't respond to immunotherapy at all. So the question is, well, why don't they respond to the immunotherapy? Why when we try to stimulate the immune system, does that immunotherapy not work for many cancers? And you know what one of the reasons that MD Anderson figured out? They didn't have enough fiber in their diet. Do you know that having enough fiber in your diet by itself can dramatically increase the benefit of immunotherapy if you're being treated for cancer? Who would have thought of that? Who would have thought of that? You know, this is new research that just came out this year. And so that's why being on a plant-based diet is so critical. No matter what else you do for cancer or any other chronic disease, make sure you're on a plant-based diet that's rich in all kinds of nutrients and a lot of healthy forms of fiber and prebiotics. Now, but what Dr. Angus Dalgleish figured out, he says he was asked, why do so many people not respond? And you know what he finally discovered? It's the people with the low vitamin D that don't respond. And when's the last time an oncologist measured a vitamin D level? In fact, they're being told now by their professional societies, don't need to measure it, which is horrible advice. Every oncologist, anybody who's trying to prevent cancer, anybody who's trying to treat cancer should be optimizing their vitamin D level, no question. Why? Because it activates the innate immune system, which is the only part of your immune system that actually fights cancer. So, Dr. Angus Dalgleish said, we are now recognizing that if the vitamin D blood levels are less than 40 nanograms per ml, less than 40, you're not going to respond to cancer treatment. But if it's at least above 40, now you're much more likely to benefit. So we should be doing that, and that's the same. It's exactly the same thing with diabetes. You have to have a high vitamin D level, because if you don't, you're more likely to have all these low-grade infections. Your immune system is going to be suppressed, and we're now in a new era of immune suppression, of immune dysfunction. We have to work extra hard to strengthen our immune systems right now because of what's happened in the last 4 or 5 years. So we got to work harder, and vitamin D is one way to optimize that process and dramatically lessen our risk of autoimmune challenges to our pancreas that are causing diabetes and damage to the pancreas. Okay, so minimizing your exposure to toxins and daily practicing hydrotherapy. I'm going to end with that. If you don't have access to sauna or some way to do hot, cold, alternate hydrotherapy, get your own little sauna. Now, I've struggled for years wanting to get a nice big, wood sauna that I can put in the backyard next to my pool, but they're expensive. We're talking $4,000. And so I just never could, convince my wife that we could spend that kind of money on a sauna. So recently I was at a medical conference in San Diego. This was just a month ago. And at the conference, they were promoting far infrared little portable saunas that you can just put into one little satchel bag and carry it away. And so I said, I want to buy that sauna. I'm carrying it away at the end of the conference. So they sold it to me, and so they cost about $1,700. Okay, but there's ways to get discounts on them. But I now, at least 3-4 times a week after work, I zip myself up into this little sauna that's literally sitting in our family room, and I watch the news or watch the basketball playoffs. And I'm zipped up in there, and I'm just sweating, just dripping off of me. And I got towels laid down there, nice comfortable chair right in this little sauna. It's by 3 by 3 by 4, and I'm detoxifying. But the most important thing that's happening is that I'm activating my innate immune system, which is the part of the immune system that is not working when you initially get the infection. Those first 5 to 7 days after getting exposed to COVID, the immune system is acting like nothing happened. The innate immune system is paralyzed, is not paying any attention to this virus that's replicating in our body every so many minutes. And if we just simply activated our innate immune system through increasing our body temperature by 1 to 2 points, 1 to 2 degrees Fahrenheit, you would basically burn off that virus very quickly. So hydrotherapy, or heat and cold strategies, are very powerful ways to actually improve your immune system and improve your diabetes and help you reverse prediabetes as well. So that is a summary of the 21 strategies to reverse insulin resistance, and more strategies in the handout for you to read, and how to do the test yourself. So I'm hoping that all of you can go home today with an idea and download that document from my website where you can actually order the test yourself. You now know how to interpret the test. This is going to be on various social media platforms for you to review. This is like a training course for you to be chairman and chairwoman of the board of your health in this process. This is important for all of us. Okay, and so I'm hoping that each of you can do these tests, implement the strategies to learn what works for you and what doesn't, and maybe in 5 weeks you'll be calling me up and say, "Hey, Doc, guess what happened?" And so I'm hopeful that you will improve your health in a mighty way. And would you allow me, as we're ending here, to ask the Lord's blessing on your efforts today? Oh, yeah, okay. So let me say a word of prayer, and then those of you that are able to stay and ask questions, we'll take care of questions, both English and Spanish. Dear Father, we are grateful to have the knowledge and the insights. Well, we can dramatically improve our health. We can understand what our strengths, what our weaknesses, what our opportunities, and what our threats are, that we can start doing something about it right now, that we have a great capacity to heal from illness if we're just willing to learn how. Be with us as we seek to implement these strategies. In Jesus' name, amen. Okay, I know that some of you need to leave. Feel free to leave. But those of you that are eager to ask questions, I'm eager to answer them, okay? So, yes, we have an interpreter here, okay? And so are you going to, why don't we start with some of the questions that have come up from Spanish, if you have some? How do you want to do this?
We will ask the question by using the microphone. He will listen and he will
Okay,
translate.
all right. Some of you may need to interpret the English as well. Sometimes I don't hear as well. Okay, all right, go ahead. I'm going to look at whoever has the mic. Stand by the person who has the mic. So, okay, all right, yes.
Siempre nos han enseñado acerca de que debemos reposar después de comer. Que hay,
They have always told us that we are supposed to rest after we eat.
Yes.
que hay de la digestión con su recomendación.
Sí, yo nací en Sudamérica también, so entiendo. Yes, so,
So,
it is.
so then he said, so what is your recommendation?
So yes, culturally, in certain communities, it's like you got to rest after a meal. Now, let me help you understand where that came from. Especially in communities that are near large bodies of water or lakes, the last thing you want to do right after a meal is to get into the water and go swimming. Why? Because the water will draw the blood away from your visceral organs, or the food rather is drawing blood away from your muscles, and your muscles are more likely to cramp. I was at a picnic on Guam on a family beach years ago, and there was a lady after the picnic went swimming. She was in 3 feet of water and she drowned because she had massive cramps in her legs. And you're more likely to cramp in the water right after a meal. So you wanna avoid going in the water or swimming right after a meal. But the very best thing that you can do is go walking immediately after the meal to improve digestion and improve cognition.
Así. Yo tengo la pregunta. Yo he escuchado a un doctor nutricionista adventista que siempre aconseja de que para las personas diabéticas, si uno cocina la papa.
I have heard there's an Adventist doctor and nutritionist who talks about when you are cooking potatoes, for example,
Sí, o el arroz o la avena,
or rice or oatmeal,
de un día para otro no produce la glucosa que sería si la comes fresca.
from one day to the next, it doesn't produce the same level of glucose that it would if you were to eat it fresh.
Okay. So how do you know how well that works? By testing your blood sugar. And so that's the beauty of what I've responded to, what I've discussed with you, is that you never know how it affects you until you actually check your own blood sugar. Okay, so all of us are different. Some of us, it doesn't matter whether they're fresh or not because it's not going to increase our blood sugar. Others of us need to be very careful and limit even the fresh potatoes because it's going to increase our blood sugar. So we're not going to know how to apply it to our lives unless we test. Good question.
Quiero preguntar, yo tengo el aparato aquí en el brazo para estar checando mi azúcar.
I have the device here on my arm for checking the sugar.
Y no he comido más que un banano a la hora de venir para acá.
And I ate a banana before coming over here.
Me subió bastante la glucosa a 196, 198.
And the glucose went up to approximately 196 to 198.
After eating a banana?
Fue después de comerse.
How long after? How many minutes or hours?
¿Cuánto?
Una hora.
1 hour.
Una hora? Okay.
94.
¿Y la pregunta?
Ahorita está.
¿Cuál es la pregunta que
Perdón, era 198 una hora después.
It was 198 1 hour after.
Ahorita está a 94.
And it's currently at 94.
La pregunta es,
And the question is,
algunas veces en la noche me sube bastante, casi a 200.
sometimes in the evenings it will go up to approximately 200.
y en la mañana a veces me baja a 87, 86.
And sometimes in the mornings it will go down to 86, 87.
Y me estoy poniendo insulina
And I am taking insulin,
en la noche y en la mañana.
both at night and in the morning.
Me dijo el doctor que me pusiera 30 de insulina en la noche y 30 en la mañana.
The doctor told me that I should take 30 of insulin at night and 30 in the morning.
Pero tengo ahorita que estarme poniendo solo 20 porque me baja demasiado en la noche, en la mañana casi no puedo
But I've only
caminar.
been taking 20 at night
Okay, very important. So here,
because it will go down too much.
the key here is that, especially for you, you need to be able to manage your insulin dosing. If you start doing the things that I talked about, if you start optimizing your diet and exercising after meals and getting fitter, what will happen is your blood sugars will start coming down right away, and you will have to cut back the amount of insulin you're taking at night and during the day. Because if you do not, your blood sugars are already dropping to a relatively low level part of the day. And so if you add anything else that's healthy that improves your sensitivity to insulin, the amount of insulin you're currently taking is going to make your blood sugars go too low, and that will be bad. So in order for you to implement the strategies I'm suggesting, you need to be very aware of how quickly you change your insulin. What some doctors will suggest is that they would rather have your blood sugars go up a little high initially to keep you from the bad outcome of having low blood sugars. So that you would work with your doctor to maybe cut your insulin down by 10, 20, 30% and see how that affects your blood sugars. You're going to be checking your blood sugars so you'll know the impact so that you can work with your doctor to decide what's the appropriate decrease of insulin. Otherwise, you're going to have low blood sugars. So you want to protect against that.
Dr. West, I have several questions. Actually, I don't know how to do this. You want me to ask them one after the other, or give the opportunity to other people to ask their questions as well?
I'm sorry, can you repeat that?
He said that he has, instead of one question, he has three.
Oh, that's okay.
Why don't you ask him one and then go to another person?
Well, start with one and then whatever.
Okay,
Let's start
okay.
with one.
That sounds fair. Can you talk a little bit more about the interaction of the hippocampus and the relation to the brain function in relation to glycemia?
Talking about the interaction about blood sugars, high, low blood sugars, and how it affects the hippocampus, which there's actually two hippocampus. There's hippocampi, one in each hemisphere of the brain. It's the little part of the brain, the size of your thumb, that is responsible for your ability to convert short-term memory into long-term memory. And it's the very portion of the brain that is measured on a brain MRI test by your neurologist that is used to diagnose whether or not you have enough damage or atrophy or destruction of those memory cells in the hippocampi of the brain to qualify you for the diagnosis of Alzheimer's. You can actually go on YouTube and write Glenn Campbell, Mayo Clinic, and you'll see the videos of Glenn Campbell being diagnosed with Alzheimer's at the Mayo Clinic by the neurologist, showing him the scan of the MRI of the brain, where the hippocampi are and how they're losing atrophy. So we now know that the main driver promoting Alzheimer's, the most common driver, is blood sugar irregularities that involve high blood sugars, high insulin production, low blood sugars, really bad for the brain. Low blood sugars basically destroy memory cells. And then the cortisol response to low blood sugars, extra cortisol is produced, that also destroys brain cells. Basically, it's a roller coaster of hormone changes that are really, really bad for the brain. And you know, I literally could talk about this for 8 hours, and you can actually find those 8 hours online. You can go to the Washington Seventh-day Adventist Conference website. They have a whole series I did last month on hippocampal rejuvenation. Okay, I did 8 hours of lectures for the Amen Conference just last month on that very topic. So it's a very important topic. There's also, I did a big series for the Yucaipa Seventh-day Adventist Church, and you can see the whole series I did for them on that very topic that was done last fall. So the bottom line is that when blood sugars are out of balance, we have this dysregulation, this insulin resistance, that initiates multiple mechanisms that cause destruction of the very memory cells that lie in the hippocampus. And so we can be losing up to 1,000 memory cells a day because of this damage. But now we know we can actually regain, we can reform, we can produce from brand new 700 to 800 new memory cells a day in our hippocampi. So we have the opportunity to recreate the hippocampi and regrow it. But that requires that we reverse this process like we talked about today. Very good question.
Would I like him to continue?
Yeah, go ahead.
You mentioned a lot about diabetes, type 1, type 2, but you didn't mention about juvenile diabetes. Is juvenile diabetes genetic?
So everything has a genetic component. But the main cause of juvenile diabetes, which is the old term used for type 1 diabetes, it's the same thing. Okay, so you can have juvenile diabetes as an adult. You can have, and it's just, that's why we call it type 1 now, because it historically has happened in juveniles and young people, and it's usually caused by either an infection or a vaccine related to the infection. Okay, so any stress on the immune system, you know, that's the whole theory behind vaccines, is that they're initiating a stress that is stimulating your immune system to be able to fight an infection later on. Unfortunately, maybe 1% of the time, that vaccine is actually causing type 1 diabetes, like Gardasil vaccine. You read the insert, and one of the side effects is it can cause type 1 diabetes, not in everybody, but in about 1% of the population. And so we just need to know that. That's why informed consent is so critical for any medical procedure. And we haven't done a really good job of initiating informed consent in the last few years. So anytime there's an immune challenge, that can create damage to the pancreas. It's like a toxic effect. So a toxin from the environment can cause damage to the pancreas that leads to type 1 diabetes or juvenile diabetes, but usually it's an infection that is so significant that within a week or so after the infection, that person now has no beta cell production of insulin, and now they're officially a type 1 diabetic. Let me give you a quick story. In 2020, at the beginning of the COVID pandemic, I received a call from Mexico City, and the mother was just distraught because her daughter had been diagnosed with type 1 diabetes. She was 11 years of age. And she told me the story. She said the mother had COVID, and she had all the symptoms, the traditional symptoms of COVID. Her daughter never got one symptom of COVID. But about a week after the mother got COVID, the daughter started developing diarrhea. And then she became very weak. And so she just thought maybe she just got food poisoning or something. And so about 4 or 5 days later, she was still having diarrhea. She was still weak. So she took her to the doctor, rightly so, and the doctor was very wise. He immediately did a finger stick blood sugar, and the blood sugar was above 700. So that 11-year-old daughter from Mexico City had type 1 diabetes. And so she was desperately trying to figure out, is there a way to reverse this? And so now, interestingly enough, I've had patients who were just diagnosed with type 1 diabetes, and because I was treating his wife for a separate condition, he already knew what the cause was, because she was having all kinds of rare health problems, autoimmune problems, and we discovered that their apartment in LA had mold in it. And some people are very, very sensitive to mold. You know, when my brother John and I, when we were with Yvette, when we were in Guam, I didn't think anything of mold. Everybody had mold, right? And we would just clean it up. And I thought, hey, I'm super healthy. It's not going to bother me. Boy, was I wrong, because later on I found out I'm super sensitive to mold. Not physically. I didn't have symptoms. My body just holds on to mold toxins. So I built up over 14 years I lived on Guam. My body built up the mold toxins, the mycotoxins, and those are proven to cause diabetes. Proven. I have the studies to show it. And so fortunately, I figured out that I had this problem about 7 years ago, that I'm very sensitive to mold. I was full of mold toxins when I did the mycotoxin urine test, and then I was able to start a detoxification program that basically helped remove these mold toxins from my body, because they weren't coming out. They were just staying there for decades. Okay, so that was setting me up for autoimmune problems later on. So this 11-year-old girl in Mexico City, her only symptom of COVID was diarrhea. And did you know that the COVID virus is actually an enterovirus? It actually tends to stay in the gastrointestinal tract, and that's why she was having diarrhea. Her body was trying to get rid of the virus as fast as possible, and so if she would have just taken charcoal upon the first symptom of diarrhea, that charcoal would have drawn out the additional viruses in the spike protein and got rid of enough maybe to prevent her from becoming type 1 diabetic. Because the spike protein from both the infection of COVID and the vaccine that generates the spike protein, that spike protein is toxic and it will damage the pancreas. I have the studies to document this. There's no question about that, especially for those of us that are already sensitive and already on that road of pancreatic beta cell destruction. So be very wise about this. This is very, very critical. This is why, for instance, the CDC director, Dr. Robert Redfield, during the pandemic, he was the one supposed to be in charge of the pandemic response. But he was not allowed to be. You know why? Because he was against the lockdowns and he was against mandating the vaccine. Interesting. So he has now come out officially and said that he would never give the mRNA vaccine. This is the past CDC director, Dr. Robert Redfield. And the reason why is because you absolutely have no idea what dose you're giving the patient. Would you ever, as a doctor, would you ever give a patient an injection of something you have no idea how much antibiotics there is there? You have no idea. You're just giving them a whole bunch. That's the problem with the mRNA platform. It's a horrible, horrible platform. Nobody should ever take an mRNA vaccine, in my opinion. Okay, and that's, especially if you want to prevent diabetes, dementia, and heart disease, and all kinds, and cancers, right? So be very aware of that. And I know it's a controversial area, but truth is truth. Okay, so if this young girl had just had charcoal initially, okay, and she would have treated the COVID infection right away before it left her lungs and got into her organs and damaged her pancreas, she would not be a type 1 diabetic today. So we got to stay away from toxins, stay away from infections, and that's critical, because those infections also affect the brain in the same way.
Okay. I just wanted to know that
All right, 11 minutes. Right, we'll do quick answers. Okay, you're in charge.
Okay, sir. And then later we'll go. Okay, here.
Thank you for coming.
Thank you.
Okay, I got three little small ones right here. The shots that they're asking us to take right now for COVID and this and that, do we need to keep taking those shots that they're advertising at the pharmacies and stuff like that we can get?
Okay, good question. Bottom line is they were never effective and they never will be. Okay, so the Cleveland Clinic did a very big study of 48,000 of their employees. They're the number 2 clinic in the world, and they showed that the more COVID vaccines you got, the more likely you were to get COVID. So if you had 3 or more vaccines, COVID, mRNA vaccines, you were 300% more likely to get COVID after getting the vaccines compared to those who never got the vaccine. So the bottom line is, even if it was effective, it wouldn't be recommended because it's so dangerous and it's not safe. The safety studies were never done on that. Okay, and so the Dr. Redford's recommendation is not to do it, and I would be even more adamant than him. Is there's absolutely no need. In fact, the vaccine actually depresses your immune system. So that's the worst thing that you can do. The worst thing that we can do is take something that makes our immune system less able to fight other infections. Okay, so that would be my answer. And I know other doctors would have different perspectives, but if I know anything, I know that.
Okay, thank you.
Yeah.
Another one. Okay, I'm allergic to water in a way. I don't like drinking water. I should drink water. My wife forces me to drink water. And,
Good for you, wife.
So for some reason, I don't have a taste for water anymore. So I don't drink much water, but I have to force myself with my wife to drink water.
You could always do it through IV if you have to.
I don't know. Okay, the other thing is...
So you'll see that on my handout, water is very important,
Yes.
that you have enough of that, because not enough water is actually a stress on your immune system.
Yeah, one more. Why do I get sleepy when I eat food, breakfast, lunch, and dinner? But in the middle of the meal, I'm yawning.
Okay,
And then afterwards, I'm still yawning, and I feel like sleeping, but I don't sleep.
I have the perfect answer for you. Walk immediately after the meal. The reason we feel tired at times, and many of us have that as well, is because we're insulin resistant to a degree, and that blood sugar, the insulin is going high, and then blood sugars are starting to drop. They're not necessarily low yet, but they're dropping. So that makes us tired. We're all kind of warm, fuzzy. So you need to go exercise lightly. Go for a walk right after the meal.
Yeah, thank you for that,
Yeah.
because I already get that. Thank
Yes.
you very much.
You're welcome.
Yes, thank you. And I'm really excited about taking the glucose tolerance test. I see that's a priority. My question is, in the beginning of the series, which is really good, you mentioned a lot of genetic testing and toxin testing. And, just as a layman, let's say 6 months from now, I really nail this glucose tolerance testing, and I go to my doctor, and I know doctors are going to be, why do you need it? Which one do you need? Do you need all of them? Do you have the tools? How do we answer those questions? Because it seems like those tests are pretty important too.
Well, and that's the challenge. And a doctor is not going to order a test they don't understand. So if they don't have training in that test specifically, then maybe they shouldn't order that test, because now they're responsible for it and they don't know the answers, right? And so that's why I just yesterday I met with somebody at the Wildwood conference, and they said, I did the 2-hour or the 3-hour, in his case, glucose tolerance test, just like I'd written about in my book 10 years ago. And then he was trying to get somebody to interpret it, and his endocrinologist wouldn't even see him. He knew that what it was about. He said, I'm not going to see you, because basically he didn't have an answer. So that's why I've done this training. This is kind of an in-service training for a lay understanding of how to apply this yourself and how to order it yourself, so that we don't have to rely on having it ordered by somebody that maybe doesn't have the training or the understanding of how to interpret it properly. And, you know, there's a lot of other tests. You know, if you go to that same part of my website in the labs, I have several pages of labs that you can order. Okay, again, you might have to order it yourself, but you're still going to need interpretation, right? And so, you know, that's what I do professionally, is help people understand that. So for anybody that wants to expand beyond what I've addressed today, you would want to work with somebody that has that understanding. Not necessarily me, but that's exactly what I would do. Get into the genetics, get into the urine testing, the toxin testing, get into the extensive lab testing. It gives us information that we'd otherwise never get. Yes, Yvette.
Mi pregunta es, mi familia, con mi esposo, yo y mi nena, pues por situaciones migratorias fuimos obligados a ponernos las vacunas del COVID.
My question is, for both me, my husband, and my family, because of migratory issues, we were forced to get the vaccination.
Y empezamos a tener demasiadas molestias con mi esposo y ahora somos prediabéticos.
We started having suffering some adverse effects, me along with my husband, and now we are pre-diabetic.
Quisiéramos saber si hay alguna forma de desintoxicar o cómo podemos proceder en este caso.
Is there a way of detoxifying ourselves, or what would you recommend as a way of dealing with this?
Yes, there is. Absolutely. Good question. I deal with this every day in my practice. I'm helping people to address the fact that there's spike protein in their body that came either because of an infection, okay, that they were sensitive to, or because of the vaccine. Okay, and a study just came out from Japan 2 weeks ago showing that there was still spike protein in the cerebral arteries of people that had the vaccine more than 17 months before. And so we're basically, the longer we look for the spike protein in the bloodstream, we're finding it. And so the answer here is that the reality is that we now know definitively from multiple labs around the world that both the Pfizer and the Moderna mRNA vaccines were not quality tested, and they had very high levels of DNA plasmids in it that should not have been there. That should have been removed prior to the vaccine being used. And the DNA plasmids are basically DNA particles that can get into your own DNA, and now your body is making spike protein indefinitely. Indefinitely, because it's now part of your own genome. That's why it's a genetic treatment therapy. It wasn't a traditional vaccine at all, right? We know that. They had to change the definition. But the good news is that even though that is bad news, that is something that's in your body and potentially forever, so we need to have an answer, an antidote to get rid of that spike protein that we know is toxic. There's no question that the spike protein is toxic. There's no debate on that. Anybody who debates that absolutely has no knowledge about the system. Okay, so we need to get rid of spike protein, and here's how we do that. There's plenty of research showing that nattokinase, which is a systemic enzyme, the Japanese eat it. They eat natto, right? You've heard of natto? Okay, natto is full of nattokinase, which is an enzyme that chews up spike protein, that neutralizes it, that inactivates it, so it's not toxic anymore. So I take nattokinase every day because I have the factor V Leiden mutation for blood clotting that I mentioned earlier. Okay, but nattokinase will help get rid of spike protein. So that is Dr. Peter McCullough talks about recommending. He's recommended it for a couple years now. I've been recommending it for 20 years. Okay, so before spike protein was even an issue. So we know nattokinase is good. We know that N-acetylcysteine, or NAC, NAC, also helps break up spike protein. Bromelain helps break up spike protein. Curcumin as an herb, as a spice, helps decrease inflammation associated with spike protein. So those are 4 things that I would suggest right away. Bottom line, NAC is 500 milligrams 2 or 3 times a day. Nattokinase is 100 milligrams twice a day, empty stomach, at least 45 minutes before a meal. That would be the first strategy I would implement. And I've helped many people treat vaccine injury or COVID injury and benefit greatly by doing those strategies.
Thank you very much, Dr. Youngberg. Pastor Gama, as one of our guests asked, if we are going to be, I know that it's being recorded, how long is it going to be in on Su Casa Facebook or website?
The YouTube channel is going to be there.
For good.
Yeah. Yeah, on the website, I think it's down to 3 months.
On Facebook? Okay. Okay.
Perfect.
Dr. Youngberg, you just actually ran out of minutes, but out of kindness, we're going to add this lady. The minutes are gone, but I'm going to tell her to be brief because your time is over. But she's going to ask a question.
Impossible.
Tiene que ser breve, porque el tiempo se le acabó.
¿Puede la diabetes elevar los niveles de potasio?
Can diabetes elevate your potassium levels?
Well, not necessarily. Rarely would it do that. And I've been treating diabetes for 35 years, and I've only seen a couple people with elevated potassium. That's usually when the kidneys are not able to get rid of the potassium properly. The reality is that we all need lots of potassium, but if the kidneys lose their ability to filter properly, that can lead to an elevated potassium. And that becomes more of an acute care issue of working with your doctor. Your doctor can prescribe a fiber binder. The doctor can prescribe a binder that will get rid of potassium so you can continue to eat healthy foods which are high in potassium. Do not make the mistake of stopping eating potassium-rich foods. You need to use a binder to get rid of potassium, because if you stop eating potassium-rich foods, you're not going to be healthy. So there's a problem, there's a disconnect in dietetics and in medicine on that point. Eat a healthy diet that's rich in potassium and take a potassium binder if you need to lower your potassium. Otherwise, you're not going to be on a healthy diet.
Well, thank you very much, Dr. Youngberg. Let's give him an applause for his presentation. And then he just already prayed. Thank you. Okay. Muchas gracias. ¿Está bien?
Gracias. De nada.
Okay, thank you very much for coming. Su Casa Church is developing a program for those interested in following up with his suggestions. Isn't that true, Pastor Betancourt? And if you have any questions in the future, you could refer to our website. And how could they write, Pastor Gamaliel? How could they write to us if they want to continue with a follow-up? Like, because I know that some churches have programs to follow up with diabetes. So we will keep them informed in case they have questions.
If they need more information, they can go to sukasachurch.org and go to info and send us an email.
Yeah, okay, great. Well, thank you very much. Gracias a todos por estar aquí. Y nos vemos la próxima vez. You're more than welcome to come to Su Casa Church. Anybody who is not a member. We're a very friendly church, and we are here. Okay? And you could visit him at Temecula, California. Okay, gracias. Adiós. Un aplauso.
Thank you. Thank you.
My father was a real inspiration for us in South America, 1960.
Oh.
Yeah, in Chile, Brazil,
In Chile?
other places.
Yeah.
Yo nací en Chile.
Yeah. Oh,